I never went. Say when, Kelly.
Alrighty, I'm ready.
Set? Okay. We'll call the meeting to order. Roll call, please.
Mr. Olson,
Here.
Ms. Gapsky.
Here.
Dr. Kintock,
Here.
Mr. Meyer,
Here.
Mr. Morehouse is trying to get on. Mr. Stupak,
Here.
President Albrecht.
Here. We have met compliance with all official notifications. Members of the public wishing to address the board on any of the topics included on tonight's agenda may do so by emailing their comments to the deputy clerk at kelly.pugh@superior.k12.wi.us. Comments can be submitted at any time up until the meeting adjourns on Monday, July 20th, 2020. Comments should be focused on the items being considered by the board and should be restricted to no more than 400 words in length. Before we get started, tonight's meeting has 3 action items on the agenda. The third action item will by far entail the most discussion tonight. I'll ask that during this discussion, we all keep an open mind and listen to everything each person has to say. Okay, the third action item is not to determine which option we will open school with in September. Keep that in mind. But is to approve 3 options on how school could be opened in September. The decision on which option to open school with will happen as we get closer to the school start. Our intent and our hope is to have the Douglas County Director of Health here in August, at our August 3rd meeting, and hopefully a subject matter expert to tell us where our community is at, to give us their opinion on how they think we should open, and to answer any questions the board might have before making that decision in August. So tonight is just to approve 3 options that we're looking at. We're not necessarily saying which one. So, but as we get into those 3, we can weigh in as to how we might want them to look. Those are the things we want to do. Each one, you know. So does everybody understand that? You okay with that? Amy?
Yeah.
Okay. So with that, our first action item tonight. Second reading and final approval to changes in policy 0168.1, open meetings.
Move to approve. Second.
I have a motion and a second. Is there any discussion? Hearing none, then all those in favor signify by saying aye.
Aye.
Opposed? Motion carries. Our second action item. Administration recommends approval of pandemic addendum to the employee handbook.
So moved.
Attached.
Second.
Motion and a second. Any discussion on that?
Yeah, there were a lot of questions regarding if we'll be able to give any additional sick time. Has that been addressed at all or been more conversation around that?
Question. I'm going to talk about it a little bit when we talk about the overall plan, because there are some human resources components that are connected to it, but we need to follow the COVID-19 kind of labor laws that are around that. And so it does honor, I believe it's an extra 80 hours of sick time. So that doesn't come out of a staff person's sick bank. So we'll have that and honor that.
Another question regarding that then, and if it needs to wait, that's fine too, but I recently had to take COVID leave from my work, but I was only paid 2/3 of my time. Is that the same for teaching staff, support staff?
It is.
Well, if you're caring for a family
A
member.
minor?
Yep.
Okay, so, okay.
And we met with Kyle at length over the last week to make sure that this was in line with current law, and we're following those guidelines. So thank you, Kyle, for your help with that.
You bet.
Is there any other discussion? Or questions? Hearing none, then all those in favor signify by saying aye.
Aye.
Opposed? Motion carries. And the third action item, administration recommends approval of COVID-19 district response plans for the 2021 school year.
So moved.
Second.
I have a motion and a second. And now we'll go into discussion. And I'll
Go to presentation. I have
Go
a
through the presentation.
slideshow prepared, so. All right, Kelly, I'll kind of give you a cue. Want me just to tell you when to flip?
Sounds good.
I can't get it to pull up.
Presentation?
Been thinking since the start of the meeting.
All right, can I start, Kelly?
Not a good
Or
start.
should I wait?
But you want to sit next to me.
Okay,
I do.
can you go to the next slide? So what we're sharing with you tonight is an overview of our COVID-19 district response plan. We have been putting together this plan throughout the summer months with the intent of making sure we're looking at the health, well-being, and safety of our children, families, staff, and our community as being our top priority. I've shared this with you in the last 2 or 3 meetings that we've had, but the guiding principles that we've been using as we've developed our plans has been safety. We know that the social, emotional, and the mental health needs of our staff and our students needs to be embedded in this plan, and we need a plan to support that. And we also want to preserve the academic integrity and learning. So those were the kind of the foundations for putting this plan together. I wanted just to remind everybody who's online as well as the board here today that we received this plan from the Department of Public Instruction on June 22nd. We received direction from the state superintendent as to what school should or could look like come September 1st. Before we received that plan from DPI, we had already begun surveying families, and so we received over 60% response rate from our families. We received over 75% of our staff in survey results the week of June 22nd. We shared with you at the time what we were thinking about as we were looking at the Education Forward plan and how that would look in Superior. So we shared that with you on the 6th. Got feedback. We also met with the Superior Federation of Teachers Exec Board on the afternoon of July 7th to hear their priorities and their questions. And we also met with a stakeholder group on July 9th for the afternoon of July 9th that consisted of the student rep, parent reps, teacher reps, and administrative reps. And so we met as a board last week, and at the board meeting last week, we brought back feedback from those meetings that we've had. What I haven't put in here is all of the work that's been happening with building principals and directors. I mean, we've been pretty much meeting daily to update and put this plan together so it was comprehensive and detailed enough, and tried to address some of the questions we've heard over the last couple of weeks. And we've tried to start embedding those into the plan. You can go next. Again, this plan was developed based on the recommendations from the CDC, the Wisconsin Department of Health Services, DPI, and finally we met last week with the Douglas County Public Health to review the plan in its entirety and get final approval from them. And based on our recent conversations with them, they have approved this plan to come to the school board tonight for approval. So we met last week to go over the plan before sending it out on Friday. Just a reminder that we did have 88% of our families want us to create a plan back in June that would bring students back to school. I know that our survey was conducted prior to the surge in our community. However, we did receive a high response rate there. We also had many staff express confidence about coming back to work safely and having safety protocols in place. Again, I know that that survey was done in mid-June or late June before some of the higher transmission rates occurred. However, we've seen higher transmission rates in other parts of the state, and we've been kind of following that same process here in Superior that other school districts have been using. So for tonight, what we put together are 3 different scenarios. One thing I think it's really important for our families and our staff to understand is we may need to move between on-site and virtual learning at any moment in time, just kind of very similar to what happened to us this spring. We have to be prepared for having online learning as well as on-site learning in different sort of capacities. And so our work for the last 4 weeks has been to put together a plan that allows us to land in one of these scenarios. And so that's what we have been working on here for the last 3 or 4 weeks. The 3 different scenarios would include, obviously at the bottom, I'll start where we would have an all on-site learning where conditions go back to where potentially we have a vaccine and we can begin to phase all students back into in-person learning. We already had a model in place for all virtual learning, and that was the model that we implemented last spring. And that was an amazing accomplishment. In about 5 days, we were able to go from an all on-site learning structure to an all virtual learning structure in 1 week. And so we've had that structure in place since last spring. However, I would say the biggest feedback I've received from families in the last few months has been, we know that that happened in a crisis, and we know that you guys did the best you could to implement a model for all virtual learning. But we know if we're going to do this again, it needs to look and be more robust and comprehensive and have higher expectations and higher rigor. So we've been working all summer to create a model for if we had to go all virtual, what would that look like, and create higher expectations. But the newest model that we've been putting together for the last few weeks is, what does this hybrid model look like, where it allows us to provide social distancing at school, implement the safety procedures that we need to implement, and potentially have a scenario where we would blend on-site learning with some virtual learning. And then in order to meet our instructional minutes that we have to do from the Department of Public Instruction, we would need to create this scenario to show how we're meeting our instructional minutes over the course of the year.
Amy, did you say, so the hybrid model or the online model, you would have to meet a certain amount of minutes?
Yep, so in either model, we're still required to demonstrate how we're meeting the same amount of instructional minutes every day.
As if we were in school full-time?
Correct. Until I hear something different, that's the direction we've been given.
From DPI?
Correct.
Okay.
So the next part of this presentation is really going over that hybrid model, and that's the work that we've been doing and getting feedback on for the last 3 or 4 weeks. And so I want to just kind of go through that. As I mentioned at the last board meeting, there's not a lot of new information here, but this is based on the feedback I've got from you as well as our stakeholder groups. This is kind of what we put together that we're looking for approval tonight. So 3K was going to be a new option for families this year. So 3K would continue to run. It would continue to run Monday through Friday as a morning option. Our 4K we have changed to mirror what we're looking at the elementary and the secondary. So instead of having students attending half day, we would limit transitions for safety purposes. And so students would attend 2 full days twice a week. Either Monday and Tuesday or Thursday and Friday, instead of coming like 4 full day or 4 half days. And so it limits the amount of transition kids are having over the course of the day. We are looking at offering a virtual 4K option for families who are interested as part of this hybrid model. So if there are some families who don't want to send their child back full time in a 4K model, Jen's working to create what that could look like. And then we're going to continue parent outreach and family resource center options. Those will be virtual. Within this hybrid model, we talked about last couple board meetings that we would have students attend 4 full days. They would attend on Monday, Tuesday, and Thursday, Friday. Students would engage in at-home learning on Wednesdays. So that's how we get our instructional minutes in, by continuing learning on Wednesdays. Wednesdays would be time for teachers prep, communication, other planning that's needed, PLC meetings and things like that, that they might not be able to do because of the supervision requirements and the cleaning that we need to be focused on while kids are in session. The secondary model is similar to what we asked families back in June, what they would prefer. So this is a direct result of some of that feedback we received from our families. And it was important that our secondary comes back in some capacity. And so secondary would come back in 2 different cohorts. So half the students would attend Monday, Tuesday, half the students would attend Thursday, Friday, and they would have virtual learning on the days that they weren't in session. And then we would offer a virtual option for families who did not want to engage in the hybrid model. And that was something that the Department of Public Instruction had asked us to incorporate. Some districts don't have the ability to offer a virtual option, and so they're paying for like canned programs to push out to their families. Our virtual option will be taught by our teachers. So
it's what we currently use for virtual, will that use the online schooling? Or is it slightly different?
It's different, and I'm going to have Crystal talk a little bit about that in a little bit. I've said a couple of these things already, but I want to make sure folks know how we landed on the hybrid model that we landed on. We heard from families within our surveys that it was important to bring back both elementary and secondary students back on-site learning as much as possible. Some of the models from DPI showed the use of secondary buildings for elementary, which wouldn't allow for secondary students to come back to school at all. We just didn't feel like that was connected to the values of our community. We heard from families and staff at the secondary level, it was important to bring secondary back as well. We are utilizing the DPI models that were pushed out on June 22nd, and we know that those are embedded in best practice with blended learning. Part of the reason that we're able to bring students back at the elementary more days a week is because our class sizes are lower at the elementary, which allows us to social distance. We're not able to social distance with all the students because of our higher class size at the middle school and the high school. And so in order to properly social distance in those buildings, we would need half the student population. The social distancing guidelines require much more demand on our staff for student supervision and cleaning as opposed to a typical school day. And so I'm proposing that, or our team is proposing that school buildings would be closed to students on that 5th day to allow teachers time, like I said earlier, to communicate with families, lesson planning and preparation, professional learning communities and such. The schedules, like I said, at the middle school and the high school, that weekly schedule I shared with you was based on the preference from families. And the question I get a lot is why aren't we going to school on Wednesdays? Why not Friday? And the reason was, in the event there's a case of COVID in one cohort and we need to do something differently between those cohorts, it doesn't disrupt the learning for the next cohort. If we didn't have a gap between those cohorts, we may have to say to the next cohort, you can't come to school tomorrow. So this was an attempt to try to create more time between cohorts if we needed to have different plans or cleaning procedures in place between those two. And the elementary schedule, we wanted to mirror to that schedule, having the Wednesdays off, because in our survey to families indicated that older siblings are often needed to help with childcare during the day while parents are at work. Okay, so I'm going to get kind of into some of the nuts and bolts of this, and Molly's going to take over here in a second on some of the human resources questions. But in general, these are the guidelines that we'll be following for staff and students when it comes to coming into our school buildings. Staff and students must stay home if they exhibit any of these symptoms, and that applies to both staff and students.
Can I just ask a question related to that? Previous slide, yeah. So I had some parents and staff contact me regarding like they have allergies. So it looks like they have these symptoms, but they actually have allergies. If they had a document from a doctor, how would we handle that differently? So maybe that brings Molly into the conversation as well, but
Yep.
that was a concern as well.
That's a great question. Molly, do you have anything you want to say to that?
Yep, I've actually already had that happen. So the staff would just need to contact me and I would work with them on what we would need for that.
What about parents with children?
Then I'm guessing they would be able to contact Bryn, the health coordinator, and she would be able to work with that school nurse at that building for the students.
Thank you.
The next part goes into additional, so connected to that, let me go back just real quick, Kelly. One of the questions that we asked County Health was about whether we take temperatures, and we talked about this at a past board meeting. But because fever is only one area that can be a symptom, you cannot have a fever and have COVID-19. And we have many people who would mask a fever with pain relievers. The logistics and the benefits of taking temperatures outweighs kind of the logistics of how to do that, and you would be bringing students in potentially and having them in close quarters while they're kind of walking through. We are going to recommend, however, that happens, temperature taking happens at those before children board buses, so. So the biggest question that I get is, how are we going to handle face coverings? And I think I've said to the board in the last couple meetings, this is something I lose sleep on. So when I lose sleep over something, I continue to go back to what are the experts telling me to do and telling us to do. And so if you click on that link, maybe Kelly, click on that link. This is the information from the Wisconsin Department of Health Services, and they specifically said, should face coverings be mandated in schools? And we took the narrative directly from this. All the way at the bottom, it says, should they be mandated? And it says no. So that's why I'm basing my recommendation off of this information from the Department of Health. However, I think that is some discussion we still need to have here as a board, if that's how you want us to continue. My biggest concern is if it's mandated, how will principals enforce this with staff and students? And would we be suspending students? How would we handle discipline and those kinds of things if that wasn't happening? And I didn't know if there was any legal concerns with mandating that if students chose not to wear a mask and couldn't come to school.
There could be, especially in light of what the guidances are.
Okay.
I think that's really the issue, is if the guidance is, if it's not mandated and we were to try to mandate it, you might get some backlash. There's a couple of different ways that somebody might approach that. I think ultimately, probably a policy, because of the inherent police power and the policy-making authority of the board, probably could be upheld, but it could also be very sticky.
But if the city were to have a policy and mandate it, and we were giving students the option of staying home and doing virtual, they have a choice.
Right.
That's still an issue.
Is it still an issue?
To require
To require
masks.
a mask. Even though
Oh,
they have
because
a choice.
they can utilize the virtual if they desire to do it.
Correct. So they have a choice. So would it
I would agree with
be
that.
And that's a question I also got from a variety of people. And currently my understanding is that the city of Superior would be looking at mandating masks, but they would have a clause in there that excludes schools. So
That's my understanding as well.
yeah, okay. So this is my recommendation based on the direction I've been given at the state level, and I don't know if anybody wants to talk through that or wants some discussion about that. How do you have a preference about that?
That's like, if whether the board is in favor or.
Do you want to wait till the end or? do you
Yeah,
wanna-
can we get Molly's, you said
Sure.
Molly was gonna share, or
She's
some other
like
people are gonna
next.
share some stuff.
Yeah, you want to wait till the end to kind of
Go
maybe
through
make
the
a
whole
note of that?
presentation
Okay,
and then talk.
we'll make a
through it.
note of it.
Yeah, I'm making notes as well.
Okay, so Kelly, can you go back to the slide? Because I also want to share one of the things that we feel strongly about as a school district is teachers have the right to protect themselves. And if a child is in their class and they want to work with them in a small group or work with them one-on-one, a teacher can at any time require students to wear a mask if they cannot maintain 6 feet of distance. So, I picture students in a class sitting 6 feet apart. They could take their masks off while instruction was happening. But if they're going to work together, or if they're going to work with a teacher, the teacher can require masks are used. And there was something else. And staff also, like if I'm a counselor and if someone's coming into my office space, a counselor could, and we've implemented that here at the board office. If you want people to wear masks coming into your office space, you can have a sign that says, please stay back or wear a mask. So, okay, I'm gonna keep going, Kelly. So with that, I'm gonna let Molly kind of talk about the next 2 slides.
Okay, so we, as an employer, we have the responsibility to provide a safe workplace for all staff and the students. So as we go through this presentation and some of the other directors speak, there are a lot of safety measures that we're putting in place, and that's for everybody. So to help alleviate fears, but also to, work with some individuals that may need some sort of accommodation. as you guys looked in the addendum, we did put in there what like the protocol is for staff if they do, you know, are getting tested or if they would, if they test positive. And a lot of it is they really are going to need to contact human resources so that I can walk through the FFCRA leave and what option works for their situation, because everyone's situation is going to be different. And then what we're doing for staff, you know, we're doing the self-screening module through Public School Works, as well as the COVID training on how to keep themselves and others safe in the workplace. So that will be eventually signed out to staff before they come back for school.
One of the biggest questions we've had at board meetings in the last 2 weeks has been kind of the protocol for how we handle testing and confirmed cases. So in the plan itself, Molly, with the help of, I think you were part of that conversation, right, Kyle?
Right.
We put together a flow chart that will answer probably 95% of the questions when it comes to what happens if I've been exposed, if I live with somebody. So we put together that flow chart. However, it can't answer every single question because there's so many unique situations. That's why Molly said that really every case needs to be, we need to use that flow chart, but every case needs to go through Molly to help kind of problem solve how it's going to work for that person. So. Okay, Molly, do you want to talk a little bit about leave? This was what Laura was asking. Do you want to flip to the next slide there, Kelly? This was kind of what Laura was asking about. Do you want to speak more specifically to this?
Yes, so this information, I did send this out to staff in May because it was with the Department of Labor employee rights poster, but that it talks about when the paid leave under the FFCRA would be, and they would be entitled to that. So, you know, if they're under a federal, state, local, or medical quarantine, or they're experiencing COVID symptoms and seeking a diagnosis, that's when they would be paid for 100% up to the 80 hours. So it's prorated for part-time employees. Then the 2/3 comes in if they're caring for somebody with COVID, or they need to take emergency FMLA because their child's daycare or school was closed. So that's all underneath the law, and we put it on the website if there's questions.
Does that help answer your question too, Laura? Or is it
Yeah,
more
it just
specific?
gave me
Okay.
a nightmare scenario though, like say we had contact, we got shut down, we got teachers that are also parents.
Yep,
And so it's just like,
yep.
Yeah, one of them's got to trump the other.
Well,
And then
they're all
I
protected.
think I mentioned this before, but I did create a form that I would walk through with each employee to that, you know, determines what leave they would be using. And then like, if they are using the 2/3% of the leave, we could supplement their other time off to make them whole. So this form walks through all of that.
that's great. Thank you, Molly.
Mhm.
Okay, next slide, Kelly. This is me, right? I think this one's me. So we've been working closely with principals for the last 3 to 4 weeks to really talk about what can operations look like when we're looking at the CDC guidelines that they put together. The biggest change for schools is sitting students 6 feet apart. Also, desks will be facing the same direction. We have been working with public health and our facilities department. So if we had a table that wasn't quite 6 feet apart, can we put a barrier in the table, like a plexiglass barrier, and have students seated? And they did say that was okay. So we've been purchasing plexiglass barriers for our front reception area, and we will have some plexiglass barriers between students so they could potentially face each other without spreading. We're also looking at staggered arrival and drop-off times, locations. I've talked a little bit about this. The biggest question I get from families about this is, well, what's going to be the procedure for that? And how do I know my little one's going to get to the classroom okay? And principals are putting together plans to have a variety of support staff at the doors to help escort kids where they need to go. And our teachers and our principals are just super creative. And I know that they're going to make it clear to our families, but also in a way that the biggest thing I hear from families is it feels so sterile and institutional. And I know that our staff will do a good job of putting what that looks like, in place for so it's welcoming and warm. The other big thing is making sure that we don't have visitors in the buildings, and if a parent were to need to come in for something, to kind of make that appointment ahead of time and arrange that, but not having a variety of people in the building that we have to manage and social distance. Okay, that's it for that. I think Bobby, you're up next.
I'm here. Okay, so one of the big things that we have with this COVID issue is the disinfection is the key part to the whole program. And in order for us to literally disinfect everything that's a high-touch surface in our schools, we're going to need the support from all district staff in helping with cleaning efforts throughout the district. Some of the supplies that we've already started getting is hand sanitizers. We're going to try to get those all in each classroom, as well as the common spaces. The sprayers that we ordered are going to be benefit to us, especially if we get the disinfectant that we want, which part of our problem is broken supply chains right now and just trying to combat that. And then the MERV 13 air filters, which are your first line of air filters for the combating viruses, are on order at this time too. Does anybody have any questions for me? I know this is just 3 or 4 bullets taken from the original plan, but.
I think one of the things too, Bobby, you and I have talked a lot about is if there was a case of a confirmed case in our schools, we wouldn't know about that for 3 to 4 days, potentially, by the time the test results come back. And so as we've talked to Bobby, the deep cleaning would really need to happen every night. We almost need to act like we have confirmed cases in our schools every night, because if we wait for public health to tell us we have a confirmed case, we'll already have people exposed over the course of those few days. So Bobby, I don't know if you want to speak any more to that.
No, I mean, you hit it right on. We're not going to know that lag time is the turnaround time, especially if the numbers go up grossly. The investigations that the health department are doing to kind of track the tracing steps that they do is likely going to get backlogged. So we've got to act like we've got it in our schools all the time.
The one thing I didn't mention about the facial coverings was the question about, are we purchasing those things for staff? And so this also ties into this question. People have asked, are we going to be purchasing hand sanitizer for staff? All of our rooms now have been installed with hand sanitizer dispensers. So every room when you walk in has a hand sanitizer with this dispenser in it. And we are going forward, and we received 9,000 masks for staff and students from the state of Wisconsin, but we're purchasing more, and we are purchasing face shields for all staff who choose to use those, because some students need to see lips and some staff need to see lips, whether it's speech or phonics instruction. And so we are purchasing those too, and that's connected to this, so.
Go ahead.
Sorry, so I asked our health expert on our multidisciplinary team in St. Louis County, and we wanted to use the face shields, and she did some research, so I'm not sure who, maybe we consulted with people that have better expertise than her. She works at Essentia, but they still want you to wear both face shield and a mask. It doesn't replace a mask. And the face shield results of some preliminary research are actually not as effective, but it does cover your eyes. So that's the good thing, is that because you can't contract it through the airborne through the eyeballs, it wouldn't be a replacement though for a mask. You should still have a mask on. And we did, receive that question about our deaf and hard of, or children that are deaf and hard of hearing, or staff that are deaf and hard of hearing, how that will impact them if we did mandate masks or want masks being utilized in certain situations. I just wanted to bring that up as well. And after Steve, I have 2 questions for Bobby.
Okay. What about the playgrounds? Are the playgrounds still open, or
Yes.
how are they going to clean them? That's the question I have.
Bobby, can you answer that?
Well, part of the thing that we have in our plan right now with everybody being part of the cleaning process is we're hoping during the day that we can give those playground monitors those sprayers and they can come through and spray that Pure Tab product on the playgrounds themselves, the equipment.
And Bobby, you're creating a checklist for staff at each of the buildings. So we'll have like support staff who have like a checklist. So there'll be some things we need to do hourly through the building. Some things we might need to do twice a day through the building, like clean handrails, elevator buttons, those kinds of things. So those will be done throughout the day. And then we only have one class at a time using the playground equipment. So they'd be cleaned between classes.
Thank you.
Laura, do you have more questions?
Yeah, so I have specifically had teachers asking me what would be expected of them. Can you just give us a preliminary, like, look at what that checklist looks like, Bobby? And then can you talk a little bit more about the air quality? Because that's really the highest transmission rate is the particles through the air, not necessarily hand-to-hand contact. So hand sanitizer is great, but we're really wondering about that air quality. With the filters that you bought, can you talk a little bit more about that in all of our buildings?
Yeah, the MERV 13 filters, they're probably about your best bet for blocking those viruses from getting pushed back through the school. So as the air returns to the air handlers, it goes through the filters, the filtration process, and that removes those viruses before it gets pushed back out. We're looking at some other long-term products that we can install in our air handling units, but that's going to be a pretty expensive process, but I think it's something that we're going to want to look closer at if this is going on for a while.
And those were a very expensive purchase, but we felt it was important that we did that.
And it's in all of our schools. Because they also say having windows open is good, but like a lot of our buildings we have such good like air filtration that we don't open windows. So I'm like, okay, how do we balance that?
Yeah, and I know which schools are best for what, and that's all going to be addressed with the engineers. For example, like Four Corners, you know, places like that, you crack a window and then whatever's coming into the room, into that very classroom would also be pushed out by positive pressure out those windows. But we've got to gauge it right to where we don't have too many open in one area. Otherwise, it's just going to follow the path of least resistance.
Right. Can you just address those the cleaning lists for our teachers?
Yeah, so the teachers, we would be focused on like the sinks and stuff like that in the rooms. The biggest focus would be clean up after lunch, you know, debris on the floor, and wiping everything down after lunch, and then again at the end of the day.
What might that time commitment look like tentatively?
I would say probably 30 to 40 minutes.
We also are extending support staff hours because we know that we need additional staff during the day to help with all of those things. So that's part of the budget that we've shared with you guys in the last month, that we need to have a plan. If we did not, if not all staff help with the cleaning aspect, we would need to hire at least 8 more custodians over the district. So it's important we all, and you see Kelly and I do it all the time. We start a meeting, we wipe down our tables, and then when we leave the meeting, we wipe down our tables. So.
Yep, we're doing the same thing at my office.
Yeah.
There's only 2 staff there. Everybody's disinfecting everything you touch.
Yeah, same at
Where the kids
same at my
touch
office. Everybody's just leaning in and pitching in because it's what needs to be done right now.
Going on everywhere.
Everybody's cleaning.
Does anybody else have questions for Bobby?
How often do the MERV 13 filters, how often do they get changed out? What's the life expectancy?
I'm figuring right now 6 months. So we've got actually 2 different sets from 2 different suppliers on order right now.
Bobby, do we have a pre-filter then the MERV 13?
Some units do, some don't.
Okay, because that really saves some money if we keep changing those first ones out, and you know that.
Yep.
It's like a double.
Yep, they're double. You have a narrower one that are cheaper, a 2-inch, and then you go the 4-inch MERV 13s and 14s.
So you don't have to change out the other ones as
Yep.
well.
Yeah, you'll actually change out the smaller ones more often, and that preserves the MERV 13s to last longer. But I've only got that option in some of our schools, not all of them.
Bobby, what about changing our outside air intake, changing the difference? I know it costs a little more to bring in more outside air, but it would be safer for the building itself.
Yes, and that's part of the plan too. I just emailed Elena that we're gonna probably need to expect some added cost if we're bringing in that cooler outside air, like for example, during the winter time and having to condition it to get it to the classrooms.
Thank you.
Right here.
All right.
I have one more for Bobby. Bobby, I know I asked you this at a previous meeting, but since maybe we have more people tuned in, maybe it's appropriate to bring up again. We talked about the disinfectants that are used, you know, like right on the Clorox wipe, it says not safe to use around children. You know, with all the extra cleaning we're doing, of course, my concern would be the impact it could have on kids' lungs. And I think you shared with us that the disinfectant you're using is a safe but milder version that takes that into consideration. Would you want to touch on that again?
Our biggest hope right now is to get these pure tabs in. But again, this falls back to the broken supply chain issues that we're encountering, it like everybody else is encountering. That pure tabs is the safest disinfectant I have been able to find at all. Like, I've never seen one, it's all zeros, that is also a disinfectant. So I feel very, very strongly about this product. It's totally safe for our classrooms.
Okay. And I see that you're also going to be increasing the fresh air intake into the building, which will also help dissipate some of those extra cleaners that are being used. And as Laura said, the research is coming out more and more that it's not spread as much through contact, it is through aerosol in the air.
Right.
All right. Thanks, Bobby.
Thank you.
All right, next, Kelly. Sorry. All right, Crystal, do you want to talk a little bit about teaching and learning and what that's going to look like?
Sure. Hi, everybody. Amy already shared, obviously, what the school structure may look like for a hybrid model of when students would attend school face-to-face and when they would do their at-home learning. So the parts that I just want to mention are more about the details of the teaching and learning. There are really two things that need to guide the teaching and learning part of the three different scenarios we're thinking about. And that is, one, we need to be flexible. As Amy alluded to in an earlier slide, we need to be ready to be flexible, not just in the next couple of weeks as we continue to plan for a couple of different scenarios, but also once the school year begins in case the model that we're in or the scenario we're in needs to change. So it's going to be really important that we have that solid base layer on all of the scenarios of the teaching and learning. The second thing that really needs to guide our thinking and has guided our planning so far is there are some pretty clear non-negotiables from DPI at this time about what teaching and learning needs to include. So we know that DPI has put out guidance that we need to be considering best practices in blended learning and how that will look for our students who are both virtual and in our on-site learning. We also know that our academic state standards, which are in state statute and in district policy, need to continue to be utilized and guide our curriculum timelines and our pacing. We also know what's very important, obviously that I think is very important in our state, is that we have some local control in some of those curriculum decisions. And the things that are unique to our area that are some of the things that make our district's learning unique, like our school forest or outdoor learning spaces, or the fact that we can be really connected to our Rivers to Lake program, are things that we want to continue to prioritize in our curriculum and give our teachers voice in that planning. And then the last thing that's really important in our curriculum and instruction plan is that we continue to support our teachers. As I've mentioned at previous meetings, we created a self-paced blended learning professional development for our teachers to go through this summer. So everyone is really prepared for us to build off of that when we get together at the end of August. We also know that we need to be able to provide our staff training on the hygiene and safety protocols that Molly mentioned earlier, but we also need to provide learning for our students around those things. So we are creating the lessons in the scope and sequence pre-K through 12 that our teachers will be able to use to teach those safety protocols, hand washing, how you properly wear a mask, and all of those routines the first days of school. A couple of other things I just wanted to mention are that many of the documents that are linked into the larger COVID response plan that I'm sure you've looked at in the curriculum instruction section are for the audience of teachers. Obviously, there's a lot of depth to all of the curriculum instruction pieces, but I do want to just address two kind of frequently asked questions that might come up from a parent lens that I think are really important in the teaching and learning world. And the first is actually, Amy mentioned it earlier, that question that we've already received from parents, and that if my child needs to learn virtually this year, will it look the way that it did at the end of the school year? And we know the answer is no, that we need to use what we learned from that experience, even though we did the best we could in that crisis time, to make it a more rigorous experience that will include expectations for students and families and staff around the number of instructional minutes, the teacher to student connection, the amount of live instruction that may happen, even if you are a virtual learner. And then the second question that I wanted to mention that has come up from parents a lot is if my child is a virtual learner, or if we need to go virtual at some point during the school year, will you teach what is often called a canned curriculum? And that's a term that I think is out there that sometimes community members or parents asked about. And it's really important to differentiate the online program that we have used in our district in the past and the virtual learning that we're planning for the future. We have had a virtual learning experience option at our high school for a couple of years. And while we don't use canned curriculum for that, we have used a platform in Wisconsin eNetwork for that. We may continue to utilize that structure for students who are trying to make up a course that they may have failed. But we are going to be using Google Classroom, Google Sites, and a consistent platform for our teachers to support our student learning from. That is something our parents have requested that we do, so it's more consistent. So that's a little bit about kind of the curriculum instruction. Do you have any questions for me?
I don't know if this is the proper place for this question or comment, Crystal, and if not, if there's more coming up and you can direct me to that. I mean, while everything we've been talking about is extremely, extremely important, I can't help but sit here and listen and think about, like, the biggest question is our question of equity. You know, on every single slide it says every student, all means all, and I haven't really heard any comments yet on that equity piece. And I think it behooves us to sit here and have these conversations if we're not thinking through that equity lens, like Laura brought up last week. You know, all these conversations are dominated by the technical challenges, which we know we have on a daily basis. But, you know, social distancing, sanitizing, online versus a hybrid model versus everybody back in school. How do we get more subs? What bus routes do we have? How do we pay for all this? And part of me wonders if there's an area or a time where we're going to start saying, how do we support people with mental health needs? How do we support, how do we address frightened adults? How do we make up for lost learning? Students that are failing to connect and engage. Are school leaders prepared to support staff and students? Are teachers prepared to address these heightened awareness about racial injustices that we're seeing? You know, what do we need to know about those kids that, by looking at it through that equity lens? We know there are kids out there that don't have access to food, to safe at home environments, to computers, to broadband. So maybe there's another time we're going to talk about equity, but I feel like with the work we've been doing the last couple of years, I don't know how we can sit here and not have some kind of discussion in regard to equity. You know, it's kind of easy maybe for all of us sitting here, former educators, you know, parents, doctor, engineer, firefighter, to say it's easy for us to teach our kids at home, but we're not the entire district either.
Crystal, do you have any comment you want to make on that?
Well, Chris just asked a lot of questions. Amy, why don't you go ahead first, and I've got a few thoughts.
It's a big question. I would say the work we've been focused on for the last 3 or 4 weeks is to create a structure. Once you approve a structure for us, now I can start to answer some of those.
Okay.
Because how social emotional learning is going to look in a certain hybrid model is going to look and feel different in another hybrid model. So I need the structure. Now I can start thinking about, okay, this is our new normal. Now, how are we going to address some of the social justice issues we have to face? How do we deal with some of these achievement gap issues? How do we address with some of the learning gap or some of the learning that some of our students need additional support on? I need the structure first.
Yeah.
Now I need to start those conversations.
And I'm not trying to dismiss the incredible amount of work that has gotten thus far. I think some of my comments, I'm hoping the public kind of hears, because sometimes we do get into our little shell, our little world, that we don't always see that. So as we move forward, I'm glad to hear that those are some of the thoughts we're still going to be addressing in whatever model we end up using. But I think it's important for people to understand that we have to have something going forward for that direction.
We still have a strategic plan, and our vision is still all means all, every student, every day.
Right.
Now we just have to figure out how we're going to do that in this new world that we live in. But the reality is it's still important, if not more important now than ever.
Well, and I do, Crystal, you've said this in board meetings in the past couple of times that, I think it gave me hope when you said there might be some good that comes out of this, different things we have wanted to move forward with, that this kind of pushed us right off the, diving board, the tall diving board. So I think that gives me hope that, there will be something good that comes out of this as we move forward.
I think that's absolutely true. There are certainly some silver linings. Change is always challenging in many ways for many of us. And sometimes when we are forced to change and have to change our practices or our routines or the way things are going to look for our students, then we just have to take the leap and do it. And this is an opportunity for us to think about how we can think big or think differently, because we're in this situation and we have to figure that out. I guess the one other thing that I would say kind of in that equity piece, Chris, is that our teachers, while we're continuing to make progress and can always do better with it, our teachers have done a phenomenal job under our new vision of all means all, every student, every day, thinking about that equity filter and how we need to be thinking about supporting students in all of the ways we can. What you guys will notice in the virtual learning option that families can choose to do is we intentionally put many things in there that parents would be able to see their child will have access to if they choose the virtual learning. Those students will have access to school counseling support. They will have access to our materials in our school libraries. So there are many things in there, so parents can hopefully see that if your family needs to choose the virtual option, your child will have access to those supports.
Crystal, if people try out the virtual and it's not working for them, or vice versa, they try to do in person and that's not working for them either, are we going to have more flexibility in people being able to change their minds? Parents saying, no, this isn't working.
Crystal, can I answer that?
Sure, but I wanted to, but go ahead.
I want to say one thing and then you can add to it.
Okay, all right.
I think, well, and we'll probably overlap each other here, but first of all, we desperately need to know who needs this option so we can properly staff. If people are moving around, it's going to be really hard for me to accommodate that. However, in every single letter I have sent to our community since we have started this, I have asked for flexibility, and it would be wrong for me not to expect some flexibility the other side if they needed to switch. So, Crystal, I think there are some models that are easier to switch back and forth from. Would you agree?
Yes, and I would say that while we certainly need to know what, just like what Amy said, so we can plan for staffing, we need to know what families need. And it obviously is going to make staffing very complicated if families need to come and go or change their mind, because then staffing and support is disrupted. But I will tell you that the structures we're putting in place for the platforms for student learning and the way our teachers already work great together in their PLCs to have a common curriculum, timeline, and pacing for the class or the grade level that they teach, we're setting that system up for success. So in the event that families may need to switch the model that they're in, that their learning can be as seamless as possible, because it is likely that may come up as a question or a need, Laura.
Right, and I just think there's so many uncertainties because of the lack of awareness of how many students will actually, parents would choose this option. I just want to quote one of the emails I got out of the numerous ones I received. It says, forcing parents to make a decision for the whole year during such uncertain time can cause a great deal of pressure for the families. When we're already dealing with a lot of pressures, we're asking them if we have to shut down, yeah, you got to find childcare for your kids. So that might, if we have shutdowns on a regular basis and someone's work schedule that's not working for them, they might just say, screw it, I'm hiring a babysitter, college kid to watch my kid so I can work. We're going online. So
Great.
Thank you.
Yep.
Crystal, I was just going to say just a little kudos, because the work, basically the work you've been doing is like adaptive work, which is constantly changing and learning with new things. And I do think that you and your staff and all the administrators have done a knockout job on the fly. And you are absolutely right. Change is hard. And, with the ground constantly shifting beneath our feet, I feel like you guys have done a really good job of, I think of that ride at the fair, the fun house where the floor is always going and you guys are always staying upright.
Doesn't feel fun.
Thank you.
So, I do appreciate the amount of work. And I think it is important that we keep moving and changing. So thank you for addressing that equity question. I didn't know if this was the appropriate time to bring it up or not, but
it's connected.
Mm-hmm. Thank you, Chris, for saying that. There's a large team of leaders that does a lot of work together. So as we all know in most of our work, that we could never do it alone. So thank you. For saying that.
And there's no doubt this is difficult, messy times, and everybody is just kind of leaning into that wind right now and taking charge in their areas. So I do thank all the work that has been done from, like you said, administrators, teachers, down to support staff, to all you parents that still have little ones at home. Kudos to you too.
Does anyone have any other questions for me?
Crystal, the next slide is the before and after school programming. Would you mind just speaking to that?
Sure. So as Amy, I think, has alluded to in some previous meetings, we have been having some collaborative meetings with the YMCA because we've obviously partnered with them for before school programming in the past. We have come to an agreement that we need to be able to support families in the coming school year before and after school programming. So we're going to continue to run that program. Parents will have the option to sign up for that with the other registration that they do later this week. Obviously that staff will receive support and training to be sure that social distancing and the safety measures will be in place. We've got it in our plans for the YMCA staff who support our before school program to come and be part of training with our teachers and work with our principals before school starts at the end of August. So they know a little bit deeper about all those safety measures that we're putting in place and how those routines are going to go. Yeah, so that's a great partnership with the Y, and we know that families are going to continue to need this service. So that's in place and ready to roll.
And we'll start registration this week, so.
Yeah.
But we waited to push out registration because families can't really say whether they want to sign up for before and after school programming if they don't know what the school structure looks like. So we waited to push that out until we could give them more information. Okay, I'm going to go to Kate next.
All right. So, hello everyone. Assessment, a number of questions. Lots of people having questions, especially around our state testing. Here's what we know. Our plan is to continue to screen all of our kids for K through 8, but it will look different this year. All of the research coming out is is making sure that we know it's important to jump in and start teaching. Our kids need instruction more than they need a standardized normed test that isn't necessarily going to tell us much. We really need to jump in and get teaching and learning for our kids. So we're going to adapt this year and spend some time making sure that we have some screening tools that will be helpful to our teachers, but will not consume lots and lots of instructional time. So that's our plan, working on that with the coaches. At this time in the state, they have indicated that they do plan to have our state assessments for the 2020-2021 school year. I've had a number of questions about that recently. That is all they have said so far. I've had many questions about what would that look like if students were in the virtual option, and they have not yet provided any guidance for that. As soon as they do, I will share that with you. Grades and report cards connected to student grades will be sent electronically following the end of the quarters or trimesters. Just as a quick kind of caveat, we will not have a state or district report card this year. That kind of ties into some of the data that we look at from last year. So there will be no state, school or district report cards coming from our state this year. Any questions? Those are just some quick bullets.
Thanks, Kate.
Yep.
Kate. Progress monitoring, will we still doing, okay, great.
Yep, we'll continue to progress monitor kids, especially students who have specific goals that we want to be monitoring for an IEP, but we want to make sure that it's something that's going to give us good data. The hard part about monitoring through a normative assessment is those norms are all created pre-COVID, and I want to be really careful about comparing our kids to pre-COVID normed data, because we can't expect kids to be in the same place that their peers were a year ago, even across the nation, because they've not had what they normally would have in terms of school and life and instruction. So I just want to be, yes, we have all the tools that we need. So if teachers are seeking more information or additional data, I want to make sure everybody has what they need, but I also don't want the time to be about standardized assessments or normative assessments. I want to make sure that people feel supported and get the data they need, but are able to spend time teaching.
Agreed, thank you.
Absolutely.
Thanks, Kate. All right, Jen, these are some of the highlights. Is there anything you want to share?
Yep. Hi, everybody. I just wanted to share just the most challenging piece that we've had to sort of think through and restructure our thinking around, and you'll see it highlighted in these bullets. They all sort of go together. It's just about how we restructure early childhood and play, especially in keeping kids safe and adhering to the cleaning guidelines that we've been given, and so how we're planning to do that. We're sort of thinking along the lines of creating single-use bins or bags of toys. So taking our large buckets of toys and dividing them out into smaller buckets and bins, just so it's a little easier to manage. And we've come up with some structures to social distance in the classroom, meaning for us that looks like splitting the kids up into smaller groups and using our assistants and teachers to make that happen. So those have kind of been the big challenges in our world. Does anybody have any questions about early childhood?
Doesn't sound like it.
I had a parent send some, but I think Kelly might forward that to you so that she can get specific answers.
Oh, I saw that too.
Okay.
Sounds great.
Yeah. Thanks, Jen. Okay, next I have activities and athletics. Ella, do you want to just share what you know right now?
Yeah, so we have been using the National Federation of High School Athletics and Activities, the WIA guidelines that we have gotten so far to kind of put our sports and activities into low, moderate, and high risks. Really what's going to come down is it's going to be the decision of us as a district based on what we know from the state and the local guidelines at the time of the activity. And what we need to be prepared for is our activities could change in the middle of the season, throughout the season. You know, if we, in the event of a short or long-term closure, our activities and athletics will be canceled for that set amount of time. Right now we have limited, you know, workouts going on, and that'll kind of probably be the same until we figure out and have any direction from the WIAA. They're supposed to come out with something in the next 2 weeks to have a little bit more guidance. So right now we're kind of in a holding pattern. Our coaches will record who's going to be there, what groups they're in, just so we have as much information as possible. The other thing will be spectators and travel. So that's kind of up in the air right now. We have some great ideas. It just kind of depends on what the WIA comes out with, hopefully soon.
Just to reiterate some things you said, travel would be considered when it comes to which areas are more high risk or high transmission rates. So we would be limited in where we could travel across the state of Wisconsin. I think, you know, they allow modified activities in the hybrid model today. They're allowing at least modified practices for all these groups. And some even could compete, like golf and like cross country potentially. We don't know yet from WIAA what competition is going to look like for those other groups. But I will say that if we were not in a hybrid model and we were in an all virtual model, we would not be able to move forward with athletics and activities, and those would be on hold until we're back to a hybrid model. So
if we go online, where sports are canceled?
Correct. So this is the model that would happen if we were in a hybrid model. If we were closed, we would not be able to continue to participate in these activities.
How do they determine attendance or something like that? Or does that just go out the window?
No, that's actually, you mean like attendance for the students?
So like for your virtual day, how do you know a kid was in class that day? Like, you know, stuff like that.
We're not quite sure. We're waiting for some more guidance. If a student is in a virtual, so if we're in a hybrid model and a student chooses to do virtual, we're waiting to see, you know, how does that look in the hybrid model, whether they can and how that's going to be, how they're going to be able to participate. But we still need to figure out, Ella, we don't have this confirmed as far as I know, that if you go to school on Monday and Tuesday, you don't go to practice necessarily on Thursday and Friday when you don't have school, right, Ella?
Yeah, Crystal and I and Rick had been talking about that. There's other schools have kind of decided, you know, you could, I guess,
stop yourself there.
You could go to practice. But then it's saying like if it's during regular school hours and maybe they're having a club meeting on Tuesday, but you go to school Thursday, Friday, then clubs need to offer those meetings be virtual as well. So maybe a kid sits in a hangout while the group might be meeting, following guidelines. So that again, I think like you're saying, Amy, that might be something that comes from the WIA as well, but would be another discussion point.
Yeah.
I'll bet my money on that we'll be devising that.
That's a good bet.
Yeah. WIA hasn't even met yet.
They've provided very little guidance to districts. So we're really leaning on the national guidelines that have been very helpful.
So, I mean, Ella, you probably saw this today, but WIAA is meeting next week to talk about 3 options. One is flipping all fall sports to the spring. Spring sports will then be in the summer, and there'll be no fall sports is one of their options they're looking at. One is just leaving everything as is, and I think the third one is, again, like a hybrid model of sorts, but they have not come out and made any kind of statement whatsoever.
No, right. And I think that one model that you're talking about, they would have fall sports. They would just condense them. So winter would be the first sport, fall would be in the spring, and spring would be in the summer. That was one option that's been out there. So there could potentially be, but that again, it depends on, the state of our virus and if we can do anything.
Right.
Okay, thanks, Ella. All right, Tara, do you want to speak about student services?
I sure can. So the big question that everybody's wondering are services going to be provided for students, and they will provided no matter what scenario we are in. That won't matter if the student has an IEP, an ILP, which is for our English language learners, or a 504 plan. All those plans are individualized, so teams will be meeting with families to adjust and look at how those services will be provided based on what scenario we are in.
All right. Thanks, Tara. Anybody have any questions? Okay, thanks, Tara. All right, Bryn, are you on?
Yep, I am.
So what would you like to share? I mean, there's so much we could talk about, but we talked about temperatures. Do you want to kind of give a highlight from your perspective?
Yep, so like you said, we talked about the temperatures, and it's just not realistic for us to be able to check them when kids are entering the schools. But we will check them when they are entering the bus, and the biggest reason for that is because they are in a more condensed space. So transmission of the virus is more likely in a bus than it would be in our classrooms, where we're going to be able to socially distance. Another piece is the isolation rooms. So I've worked with each of the principals, and we have an isolation, either a room or a space in each school should a staff member or a student present with COVID-like symptoms. We will get them isolated, if it's a staff member, hopefully they are able just to leave right away and go home. If it's a student, we will get them isolated and contact parents to come and get the student. Something very specific that we deal with from the student health services is our care plans for medically fragile students. So whenever we have a student in our district that has a medical need, whether that be a severe allergy or they're diabetic, a couple examples, we develop care plans. I work with my nurses in each building, and at the beginning of the year, we develop care plans for each of those students. Those care plans will now include specific to that student based on what their medical need is. They plan for potential exposure at school.
Bryn, could you talk a little bit about your existing relationship with Douglas County Public Health and how you guys have worked together for other medical public health situations?
Yeah, absolutely. So every time there is some type of communicable disease, you guys maybe have saw that this last school year when we had whooping cough or pertussis, the county notifies me right away. So as soon as they get a positive test result, and that is a student in our district, they call me and we talk about, okay, that student's going to be excluded or they're not going to be excluded. And the Douglas County tells that student what they have to do. And then they work with me on making sure that student doesn't show up at school if they have to be quarantined or isolating. And then we also, if we start seeing several cases within a group, so say I had 5 cases at the middle school. So then we talk about, well, are they all in the same wing? Do they all have band together? So we kind of do that tracing, and we try to make those connections to see if there's a specific area that we're seeing more cases, and if we can then isolate that. I would say my relationship with them has been very good. They are very responsive to questions and concerns that I've had. Every time I've emailed them or called them, it's not even a day and I hear back. So I'm very confident that that will continue.
Between you and Molly, how will staff be notified if they had contact with the child that had COVID or other children in the classroom? Parents, how will we handle that notification? What will that communication look like?
So that communication will come from me. I will be notified, and because of the lag time we know that the county has right now because of the increase in cases, I may get that information from a parent before the county even notifies me. So if I get notified that there was a positive case, then I will contact the county and make sure it was truly a positive case, or I would ask the parent to submit the actual doctor's verification saying it was positive. And then I look at everybody that student was exposed to and all groups that student was exposed to, and I would notify them.
By letter,
Jen,
right?
I have a question when the time is right.
Go for it.
Bryn, you mentioned doing temperature checks for students before they enter the bus. If we have a student who a monitor checks and they have a fever which reaches the threshold that we determine is that number, it's 100 or whatever it is, what is our plan to communicate with parents, guardians, or adults in that child's life to let them know that they're not, I'm assuming they're not allowed to enter the bus or go to school that day? What are we doing to make sure it's in a timely fashion, make sure that child is then supervised after that point?
We just talked about that at a meeting last week, and the plan will be that if there's family there, if the bus driver can see that the student is going back to a parent or guardian or family member to watch them, that student will go back. If not, the bus driver will notify the school nurse, and that school nurse will start working on contacts to let the parents know.
Thanks, Bryn.
This is Molly too. Can I say something about Laura's question?
Mm-hmm.
So per OSHA guidelines, we also have to do employer contact tracing. So just like Bryn would work with students and families, I would also work with staff that test positive, and I would be notifying other staff in person, as well as we would send out a communication.
So Molly kind of helps coordinate staff exposure and communication, and Bryn coordinates the student communication and exposure plans, but I imagine you two will be working very closely together next year.
We don't have one-to-one health staff though, do we? One health professional at each school? Are they shared at any of them anymore?
No, we have a nurse at every building.
Okay, all right. Because we changed the job.
We restructured it so
The
it was
health
more
director
equitable.
and now, yeah,
Yeah.
okay. Thank you.
And given that we'll be working 4 days, they'll have some flexibility to work throughout the day where they may have not been able to do that before.
Okay.
So back to, Bryn, to the question where you said if a child, or Mike's question about a child getting on board with a fever and you can't get them immediately to the parent, are they going to be isolated on the bus?
That's our plan.
Okay. And then at this point in time, I mean, this is probably still in the discussion for masks. Are we going to require all kids to wear masks on the bus?
Yes, we're getting to that in a moment, but yeah.
So that child then isolated on the bus, they will stay on that bus, go to their designated spot and be put in an isolation room.
Correct. The hope would be that, you know, the parent is there at the bus stop and they can just immediately take them, but we wouldn't leave a sick child on the corner without a parent.
I mean, as kids get older, and I think of some of the places in the county, like you can confirm, there are a lot of long driveways or where kids have to walk to a designated area in order to be picked up. And I have some concerns there. Brandon, and just don't get the comment wrong here at all. God, I appreciate everything you guys are doing. The sizes of our classrooms vary throughout our district. And when we get to the specific number of kids that we're going to safely be able to put in classrooms, some of our class sizes right now are 15, some are 20, some are 24. I know Amy had talked about some magic number, and then if we're over, there still needs to be a plan of what we're doing there. Some of the classrooms have 30, 35 kids in them. So I'm worried about that variation, and then how are we really addressing that in each one of the buildings? I'm sure that's being worked out, but that's really more of a comment. It's a question type of comment, you know?
Well, it's a complicated, I mean, it's a fair question, I think. So first of all, we know that we will have some families that will choose a virtual option. So we know that our class sizes may have been at 20 and they might be smaller now. For classes at the elementary where maybe it can fit 18 students and so the 4 students wouldn't be able to fit in that moment, we would be accessing an extension of that room. It could be like at Cooper, there's a common area outside those classroom spaces, so we'll have spaces set up. We're also hiring additional staff. We're extending hours and hiring additional support staff to help kind of be that extension for the classroom teacher. So and it wouldn't be the same students coming out of the classroom. Teachers would use a process for how we would access those extensions of the classroom. but that's what the principals are working on right now at the elementary. So they'll have a plan for like, this is what our 5th grade plan looks like at Great Lakes, and this is what our 3rd grade plan looks like at Bryant. So every building is in a little bit of a different situation, every grade level and every class, because of the size of some classrooms and the size of some classes. So some classrooms are wider or longer and will be able to accommodate all kids, while other classrooms won't. So it's hard to answer that in one statement just because every scenario is a little bit different. But we know that we will have less students in our buildings next year. And then at the secondary level, by having less students, we feel like we'll be able to social distance in those classrooms.
Thanks.
Yeah. Okay, I'm gonna keep plugging on. You have a question? Oh, okay.
Waiting my turn.
Sorry.
Bryn, this is Len. Do you know, does Douglas County Health or us have, or will have a written procedure on how the contact tracing will be done and a timeline that it'll be done in?
So as far as a timeline, I'm not sure that they have a specific timeline, just because now with the increase in cases that those timelines kind of go out the window when they're not able to meet the deadlines they had hoped to. They do have procedures on how they contact trace. And that comes into play with us too, like in the schools. My nurses have always kind of followed symptoms, and for instance, when flu season comes, my nurses keep track of their flu cases and they talk to me about that. And then we talk about, okay, do we need to clean some different areas more rigorously because now we have more cases of the flu in that part of the building or in a building as a whole. So my nurses will be using that pandemic illness surveillance, which is something they kind of already do, but now they will tweak it to meet the COVID-19 to be able to assist Douglas County if we do have a positive case in that contact tracing.
Okay.
I remember one day at Great Lakes, there was like 6 kids missing from my son's class. All of them had flu. Like it was just, and then the teacher was out for a while.
Hey, Bryn, do you feel equipped to be able to talk a little bit about what we heard from Douglas County last week with how the device over time will weaken? Do you feel comfortable talking about that, or do you want us to wait?
No, I can address that. So what was mentioned by Douglas County Health is that, you know, we can't eliminate the cases of COVID. We are going to have them, but the hope is that we don't have a huge influx of cases, so that over time the virus can weaken. As viruses tend to kind of mutate and change, and COVID-19, actually, this virus is changing, this is probably more than you guys care to know, but it changes about 2 times in a 30-day period. It mutates, if you will. When that happens, it tends to weaken the virus, or at least it allows us to combat it better. So their hope, and what Douglas County Health was saying, is that if we can just continue to spread this out and not have a huge influx in cases, that virus will continue to weaken and people will hopefully not be as sick with it.
Okay, thanks, Bryn.
Bryn, I don't know, and you've probably been bombarded with information, but the National PTA did put out a Zoom meeting with 2 pediatric epidemiologists that they interviewed in that, which contained a lot of really good information for looking at it more in the pediatric standpoint of immunology. I don't know if that would be something that would be helpful for people to watch. It's not a very long one, but it was full of really good information.
Or even what she just mentioned about it weakening every 30 days.
Yes. Yeah.
Like I said, I've never seen or read or anything about that. If there's a link or something that people could go to read about that.
First I've heard that.
Yeah.
Well, that's what science is, right? Like it develops as we do more and more research.
Well, I get that, but I just haven't seen anything out there.
There was a really good article or story today on NPR about misinformation, and just again, like how science is not static. And so people are saying, well, your messaging is changing. Well, yeah, because the science is changing.
Because we're learning more and more things.
Right.
And Laura, did you watch that one? Did you get that one from Ellen, the National PTA?
I didn't see it.
That you were in on that one too. I'll forward it to the board members because I don't have young children. I'm not a teacher, but kind of listening to these 2 epidemiologists that are specialized in pediatrics and this information they've learned thus far. did put my mind at ease a little bit. So I don't even, Ellen Chica said it to me, it might be something that would be valuable to link in for parents to listen to.
Or for professional development.
Yep.
And just a PR, quick, Douglas County website does have their tracking. They just redid their website actually from the last time I looked at it. So there's a lot of different options and it talks about contact tracing, what their process is on there. So that could be helpful to the public as well.
Yeah.
Okay, can I go to the next one? All right, thanks, Bryn. Technology, Ryan, do you want to share kind of, we already talked last week about technology. Do you have any additional information?
Nothing too more additional. I guess we're obviously still working through getting these new devices ready. Still waiting on some of them to arrive because along with us, everybody else in the world needs more devices. I did have a couple updates around internet support, talking about that second bullet. I did get some communication. Charter Spectrum did provide free internet for people within the range that weren't current customers at this time, but they ended that program at the end of May. And they did reach out to us, our charter rep, and mention that they do have another program set up where we can actually sign up families that are in need and have that directly billed to the district if we choose to do so. I know there's also a low-cost option for people with free and reduced lunch qualification. So we're going to make sure people are aware of that. That's just a good thing to know in general, but people that qualify for that can do their service for $15 a month, which is a substantial savings. So that's a good way for us to, help people out where, and it also, as a bonus, will benefit us because more people will fill out free and reduced lunch applications. So, but yeah, so outside of, it's one of those things that you can prepare for, stuff for 12 months, let alone 2 months, and still not have the results you want when we have people that live in the rural areas that are just outside of good broadband range. And there's, over the last 5 or 6 years in particular, there's been more conversation around closing that gap for people. And it's, the comparison has been to electricity, where rural people need internet. It's more than just a want at this point in life. So I know, there's always talk about that, but we're still gonna service those people that are outside of those broadband areas with the Wi-Fi hotspots again, as we did last year. And I guess the one last thing I'll close with before I ask or gather questions from you is we did take the time this summer to kind of evaluate what worked well and what didn't work well as from a support perspective. We're still going to plan to have support out of the back of the boardroom there if necessary, depending on all these scenarios and how they play out. But we've made some changes within how our machines are set up, so we can hopefully reduce the amount of in-person visits people need to have. There's a lot more we can do to help people without having to drive to the building and see us in person. So does anybody have any questions?
Well, the only other thing I just wanted to point out was some of the biggest feedback we received from families this year is please have a common platform if I have kids of different ages. I don't want to have to go here to help my 3rd grader and here to help my 6th grader. And so we've decided, Google Classroom is the primary platform we use across K-12. So I think families appreciate that.
Do we know how many families needed that support, or just going back to our survey, what did that look like?
Do you mean the support of the internet, do you mean, or?
Yes.
I don't.
400.
Yeah,
Kate,
there was
are you
quite a
still
few.
on? I don't know if Kate is on or remembers.
I'm on what the question, Laura, can you restate your question just so I make sure I hear it?
Yeah, you did the survey data. How many families responded they'd need internet support?
It was roughly, I want to say 190 families, which is 60%. So of our total population that responded. So if you kind of factor that in, a number of them Ryan kind of spoke to already in terms of being in the country and having some connection, but not enough to stream videos and do the work that was asked of them. So I think it's a balance between we have some internet, but it isn't really sufficient. And I know many families, even in town, struggled with multiple users in a household. It's a quick thing to struggle with. So I would say a significant number, and that's across the state. All of the data that I'm seeing, districts are trying to tackle this at the state level because it's a need, like Ryan mentioned, similar to electricity.
So that's a cost we didn't budget for, or we did that in CARES? Because we're already at a deficit. If we have 400 families that we have to, you know, provide.
It'll be a cost to us, but we are working to build it into the budget. So I think it's already incorporated in what we already shared with you.
Okay.
Have we had a conversation with different internet support? Have they, like Spectrum, like Ryan said, did give free last year? Is that?
Well, that's what Ryan was reaching out. It sounds like that's discontinued and it'll probably be put onto the districts to support.
He said they could bill us.
Yeah, we'll take the bill now, yeah. But that might be a better option for some families in a hotspot, you know.
Yeah.
Yeah, we would definitely want to go with charter wherever we could. I mean, from a comparison of a hotspot to charter is about the same cost from a monthly perspective, and the charter performance will be much better. So where the hotspots come in is where charter's not available, and it's not, you know, a hotspot is better connectivity wise than some of the DSL options that CenturyLink can provide out, you know, near Four Corners and that kind of thing. So
I'm aware. Did we have staff that had issues with that as well? Because that's my other concern, is that a lot of employers have, not that we can afford it, but offered stipends when they're working from home or didn't have internet but need it now for their job.
I've heard that from a handful of staff that, you know, we were able to get by last spring, but if we were to do this more, we would need support. And so we offered internet support to our staff last year who needed it to work from home. And we only had a handful of people, I think, that reached out, but I think we would try to figure that out.
Yeah. Thank you.
Thanks, Ryan.
You're welcome.
Okay, we got 2 more slides. Well, sort of. All right, 2 more departments. Let's see. Jamie.
Hi, everyone. Hello?
Yep,
Okay.
hi.
Hi, everybody. We've met recently with 2 separate meetings with the elementary principals, and then we met with our secondary principals. And honestly, they've done all the legwork, keeping our students safe and how they're going to bring them to us. Students will go through our breakfast and lunch serving lines in small groups. Our staff will serve all food items, no shared serving utensils whatsoever. So students won't come in contact with anybody else's food. A combination of cafeteria and classroom seating will be used to maintain social distancing. Disposable trays and utensils will be used to minimize returning to the cafeteria to be washed and sanitized, and just to avoid multiple trips. And students will not be using pin pads in the lunch rooms either. Any other? I'm sorry?
Yes. How about food service for virtual days for our kids? Will we still have community meal, anything like that?
Good question.
I would like to tell you yes, but I don't have clear guidance on it yet. I'm checking on it every day. We run, you know, a number of programs, and I'm just keeping my eye on how that's going to work. I think, you know, I know, you know, Laura, that in our department, we do everything we can. And I think we've proven ourselves over this summer, since March, that we will do anything we can to feed our students who are in school and out of school. I don't see that as an issue.
It's been phenomenal. That's my concern, that we don't have a plan for that right now.
But Jamie, with Wednesdays in a hybrid model where there would be no school for students, we have a plan that we would support food service on that Wednesday for sure, right? Or not necessarily for sure.
Well, I have a plan.
Okay.
I'm just waiting for that. That's the iffy day. And I don't mean that, but we're going to do everything we can in order to make it happen. Again, we run a lot of different programs. Right now, you know, since March, we've been running under our summer program, and we'll see if we can continue on those scheduled days, because that gives us free meals to all of our students, not just our free and reduced students. Our after school meals program, I've reached out to CASFP, which we run that program under, and that is a free program to all of our students after school. So maybe that's an option. And I'm just not getting anybody to say, yep, you can do it with this program. And that's all based on the USDA. They're going to make the decision on how we can do that. And then that'll be handed on to DPI.
And I will say that in all of the resources we've been using to put our plans together, I feel like they continue to support the need to support food service if we aren't in school. So I feel like the messaging is there, but we just need like the guidelines now to back it up.
Absolutely. That's exactly what we're saying here. We'll do anything. It'll happen.
We just gotta wait
Is
for the-
breakfast still going to be an option then too with all this staggering?
Yes.
Well, you know, we didn't adhere to schedules for breakfast. If students come to us and they came late, you know, even in previous years, we feed kids when they come to us. We don't turn them away. It's just.
I know I was talking to the middle school and the high school today, and they're talking about a grab and go breakfast where kids would kind of have that going into their classroom. So they wouldn't even need to come to the cafeteria to avoid social distancing.
Yeah, we'll go to where our students are, whether it's in, you know, at E16 or in our cafeteria or out in the community, wherever it is. I mean, that's what we do.
Right on. Okay, thanks, Jamie.
You're welcome. Thank you.
Okay, David, do you want to give us a highlight of transportation? Because I think this is the biggest question that is out there.
All right, no pressure. Can everybody hear me?
You're on, David.
All right. So I'll just go over a couple of the quick things that we have, the main bullets. The first part is transportation. There will be requirement for registering for it. You have to sign up for it. This is something we started last year. We're just expediting it now, and I know Kate and her team has gotten it integrated into school sign up. So it's just one of the questions that are in there. It's going to be key that we get the proper numbers, the correct numbers of kids that are going to be riding the bus. Another thing with that is kids are going to be dropped off at their guardians' homes. So they are not going to have multiple pickup and drop offs, which is something new. And we're also not going to be able to allow variances. I can't have 5 kids decide they're going to go to their friend's house, overloading another bus. And then another thing is the wearing of masks. We're going to require that students wear masks on the buses. We can't do 6 feet of social distancing on the bus. So we really need to require those masks and make sure everybody's following those, including the drivers that will be wearing masks on the bus as well. So, and the big thing we're also is just encouraging families to drive or carpool their students to school. That way we'll have less numbers on the bus and we can do more distancing. So,
and
David, can I interject? I have a question about that specifically.
Okay, go ahead.
I'm wondering how we're going to enforce that on the buses, the requirement and mandate to wear masks.
So the plan is to have monitors on the bus. Also, we're going to have multiple communications out to parents saying students need to be wearing masks prior to getting on the bus. They will be met at the bus stop. If they're not wearing a mask, then they're not going to be able to ride the bus or get on the bus. One question that comes up sometimes is what if it's a first grader that's getting picked up on the Four Corners area and we don't know if parents are home or not. We will work through those. We'll never leave a kid on the side of the road that isn't being taken care of. The driver will communicate to the board office, and worst case scenario, we will get the kid on the bus and we will try and, it's difficult to isolate on a bus. They're just narrow tubes, but we will work on ways to get the kids isolated when needed. And it's going to be out in the community. We will not provide masks, but I can guarantee you there will be some masks on the bus for when we need to get it to a kid. So.
And with more students going virtually and having only half of our secondary students each day, we're hopeful that that will help to reduce the number of students on buses to allow us to social distance better.
That answer your question, Mike?
Yes, Lynn, thanks.
Okay, thanks, Dave.
Thank you.
Okay, the last part here. So the bulk of this presentation has been to share with you what the hybrid model would look like in this plan across each of the departments. The rest of this presentation is just to talk about in the event we have to go to an all virtual model. Just to reiterate what I said at the beginning of the presentation, we have already done this model. So it's really the work that Crystal's team has been doing this summer is really been how do we need to do this now in this new normal in the event that we had to go to an all virtual model for all students due to closures or staff absenteeism. Kelly, can you flip? So originally, we were directed to put a hybrid model in place to allow for social distancing to begin school. We also have a plan in the event we need to close schools again. We may have to close classes, we may have to close grades, we may have to close schools, or we may have to do a district-wide closure. Closures could potentially be short-term, like 2 weeks. Closures could be more than 2 weeks, could be a month, could be more. And closures would come at the request of public health officials or could be due to excessive staff and student absenteeism. We have a plan. The purpose of this plan is to communicate to the public, our staff, and the DPI that teaching and learning would continue if we had to go to this model. I've kind of already said that. The instructional minutes, the schedules will be consistent. I think one of the things that would look and feel different next year in a virtual model is teaching would become asynchronous and synchronous. Those are big words, but basically there would be time where we're pushing out content that's live or real time, but there also could be times where we're pushing out recorded lessons where students will watch it at their own time. So there would be a combination of those things. Virtual learning would happen daily, Monday through Friday. There'd be connections. It wouldn't be like last year where maybe you had like 2 class meetings a week, for example. It would happen daily. In a model where all students had to learn virtually, all activities and athletics would be canceled or postponed until we were able to come back to campus. Okay, so the last 2 slides are kind of my final slides, and then we can have more discussion based on the presentation. One of the things I think is really important is to outline what we've used to put this plan together that outlines what the decision-making process would look like. So we need to decide, when are we going to do all site, when are we all going to go back to campus? When are we going to do a hybrid model? And when are we going to do a virtual model? And so these are the factors that I've put up here that we would use to decide whether we were in an all virtual or a hybrid or all in-person model. Ultimately, our county is in close connection with the state level Department of Health Services. Bryn would be in daily communication, or at least weekly communication, as things evolve and develop. So at this point, when we have talked to public health and we have shared with them what this plan looks like, I point blank asked them last week, if we were to start school next week, can we start in a virtual model? And she said yes, and she recommended we start in a, not a virtual model. If we were to start in a hybrid model, would you recommend we start in a hybrid model or a virtual model? And she said, given where we're at today, she recommends we move into a hybrid model. A virtual model has been created in the event that we need to move all students to a school closure, as I said before, where we may have high rates of absenteeism, where we're ordered as state or local officials are telling us that we need to close for a short or long-term period of time. The other piece on here is I know that Minnesota is going to be pushing out their guidelines. They're going to be finalizing their guidelines next week. We'll know more about what's happening across the bridge when it comes to the Twin Ports. The communication I've had since we've been closed is please consider the conditions in our area when we're making decisions, as opposed to decisions that are far from us. And so my recommendation as part of the decision-making process would be, we'd look at what are we doing in the Twin Ports and how is that affecting us, and use the guidance of our public health experts to make those decisions, whether we're in a hybrid, virtual, or full on-site. Last slide, Kelly. So based on what public health told me last week, that if we were to begin school, we would begin in a hybrid model. We need to have sign up for the things that we talked about tonight. So we would be pushing out later this week. We'd be pushing out a sign up for families who are needing transportation services. We'd also be asking all students to decide if you're going to do the in-person hybrid model or if you're going to do a virtual model. we need all parents to let us know which model you're going to land on so that we can staff properly. In addition, like I said earlier, we'll be pushing out before and after school programming registration because now families will know what that structure would look like. And then my last point on here is it's really a community effort to help stop and slow the spread of COVID so that we can get back to normal.
I'll say the first bullet, you'd have to do that regardless. Even if
Yep.
hypothetically.
I need to know who needs those things.
If you started virtually hypothetically, I need to know that if you switched back to hybrid.
The only problem is that could change for a parent over a course of a month or two, but yeah.
What you told me.
That's what I got.
Okay.
On break or?
Can you talk about things for truancy for children, being that if they're in a hybrid model, they're told to stay home or they do have the symptoms? A lot of parents are asking, would we get more truancy? And I'm not aware of anything on a statewide level that is for giving more truancy, but if we're asking for more reasons for kids to stay home than what would usually happen, how are we gonna compensate for that? How will we handle truancy as a district then if there's not state guidance?
Wouldn't they go to virtual then?
Well, I think
They're
we
gonna be
need,
counted absent though if they're missing their AB days or whatever, something like that.
you're saying if they're absent on their virtual days? is
Right,
what you're
because they have
asking?
symptoms.
Oh. So my understanding is when a student is sick and if they have a doctor's note or if they have public health telling them they need to stay home, that would not go towards truancy. That
No,
would go
but they got
towards-
the sniffles and they got a fever.
Yeah, we're gonna have to create flexibility with families. We want families to adhere to what we're saying, stay home if you're sick. So we're gonna have to allow students to stay home and.
I mean, like technically there's days like where I should have stayed home for months or because I had a cough for that many months. Like it just has happened. So like if I had another symptom, then you're missing. What I'm worried about is kids missing more school.
I am too. Yeah.
You know.
I am too. And I think that's reality. We will have more absenteeism this year. How are we gonna?
What we have to work through.
Yep.
So that's just an unanswered thing at this
Yeah.
point.
Yeah.
Okay.
Is it?
I've got kind of a two-part question when you're ready, if you're done with
Go ahead,
that.
Rob.
So how are we, when the students are going virtually, how are we going to track and ensure that we're meeting the minimum minutes requirements for those students? And the second part, how confident are we that those who are doing the virtual learning are going to be able to keep up with those who are doing the hybrid model in terms of proficiency?
Good question. Crystal, do you mind answering that?
Sure. Without going into specifics of what middle school or high school students' daily schedule might look like, we have to think about the amount of learning that's going to be expected of them for their courses, because that's how we think about it when we plan for our regular seat-based learning. So, for example, if a student in our hybrid model in class has math, Algebra 1 for 2 hours, that seat-based or the virtual student will be expected to do the same amount of teaching and learning. Now, that may be a blend of instruction, doing some practice, collaborating with some peers, working on a project. But the students who are going to be virtual, and this is one way it'll be different than it was last spring, is they're going to be expected to work through a daily routine and a daily schedule when they're doing their classes virtually, just like a student that might be at our school in a hybrid model. So one thing that teachers are going to have to do, just like they do in our seat-based classes at school, is support those students with their learning. So if they need extra support, then they can help them progress along the way. One thing that is mentioned in our plan, but I didn't really talk about earlier, that's really important, is our virtual teachers and our hybrid model teachers are going to need to be collaborating in PLCs together. So they're going to be following the same curriculum, the same timeline, the same pacing, and collaborating. So that alone, Rob, is going to really help our virtual students in those classes stay on track the way that our hybrid model students would stay on track. I hope that makes sense.
Yes, makes sense.
Did you ask another question I didn't answer? Sorry.
No, the first piece of that was just asking how we were going to track the minimum minutes required by the state for our virtual students.
Mhm. It'll be in those daily schedules that I kind of referred to, whether you would have one of those, whether you're virtual or a hybrid. And that I gave secondary examples, but it would be the same for elementary. We have a district guidelines on how many instructional minutes each week and each day we follow for literacy, math, social studies, and science. So those kids would, no matter what setting you're in, you would be following those minute guidelines.
Kind of along those, sorry. Go ahead, Rob.
No, I just said thank you.
Yeah. Is there a way to keep siblings, okay, sorry.
Sorry, you can finish.
Well, like if you have kids at the middle school and the high school, would we keep them in the same, are we able to coordinate that?
Yes, I know that Casey and Kate have been working with the high school principals to even for, so obviously you have the same last name you'd land on. They're looking to separate students by alphabet. And so obviously you've had the same last name, you'll land on the same days. However, we know that there are some families like my own that have different last names. And so they have a process to make sure that those students are all in the same cohort.
Okay. I did like that. Now that you register online, it's like, are there other kids in the district? I'm like, finally, like we're
I don't have to
the kids
write my
together,
address.
even if they don't have different last names. Cool.
Any other questions? I mean, did we want to discuss the face mask?
I was just gonna ask you that. Do you want to do that now or do you want to take a short recess or?
Take a short recess. Take that up. Everybody okay with that? Just a quick recess?
I mean, is there?
3 to 5 minutes.
Yeah.
I'm good with that.
That'd be great.
Okay.
I ran out
Short
about
recess.
an hour.
I did too.
Back at 7?
Yeah.
It's 7? Did you say you need 7?
No, he said back at.
Back at 7. I'm just counting here.
Okay,
We are back from our recess.
okay. So I didn't really get a chance to kind of wrap up my presentation today, but one of the questions you asked Mike last week is, can we see the plan before the board meeting? So we tried to get that out to you guys as soon as it was, when it was comprehensive. We have really been working off of the same structure since we talked to you the first time, I think it was July 6th, and getting feedback from different stakeholder groups about the plan and the structure moving forward. And so what you see today is based on those conversations that we've had over the last 2.5 weeks. The plan that I presented to you was the direction that we were given as a school district by the state superintendent to develop a plan for what we would do in a variety of scenarios. And we had to create a hybrid model that did not exist currently in our district. So that's what I've shared with you today. And like Len said, what we need from the board today is action to move forward with our plan so we can start communicating with families and staff what that plan looks like specifically. So with that, I know you have some public comment you want to talk about.
I'm just giving up to public comments. There's well over.
Do you want us to start with them? Or are we doing the mask first?
No, comments first.
Comment first? Okay.
So.
All right. I can start. You want me to start? All right. Hello, as the son of 2 teachers that work for the Superior School District, I am writing to express my strong concern about the proposed district policy regarding the wearing of facial coverings, masks for staff and students during the upcoming school year. While I agree with the importance of reopening schools this fall, I also believe the school board must take all possible steps to protect the health and safety of the district students and teachers. Unfortunately, the current proposed mask policy, where masks are encouraged but not mandated, fails to keep students and educators safe. Several studies have demonstrated the importance of wearing masks to slow the spread of COVID-19, and the CDC and Prevention Director Robert Redfield recently said of school reopenings, face coverings are key. If you look at it, the data is really clear, they work. Therefore, I urge the school board to revise its policies to require the wearing of masks for the upcoming school year in order to prevent the spread of COVID-19 in Superior schools and to keep students and teachers safe. Thank you for your attention on this important matter. Sincerely, Tommy Wolf.
You want me to go?
Sure.
Should we go around?
That's fine. Just go around circle, take turns.
All right. I'm ready to ask the board if they would be sticking to the non-mandatory masks for students and teachers at middle school and high school. Some of these kids need some in-person learning for any academic success. As a parent of 2 middle schools and 1 high school student, I'm concerned about the non-mandatory mask at the school. Yes, social distancing, it is a theory, but in reality, these are children. A lot of well-educated adults cannot social distance. This is not just about kids, staff, and teachers. It's about what they will bring home to their families. Thank you. And it was put out by Jamie Kay.
Hello, my name is Jody Rudnicki. I'm a kindergarten teacher at Northern Lights Elementary. I want to express my opinion that I am in favor of the proposed hybrid model. As a kindergarten teacher, I need to see those faces in my classroom, masked or unmasked, to build my community of learners. The idea of teaching kindergarten with the social distancing guidelines has my head spinning. However, trying to teach kindergarten solely online is impossible, simply impossible. I know that we, as a district, may need to move to online teaching throughout the year based on COVID cases in Douglas County. To make that transition successful, I need to have personal, face-to-face interaction with my students. I feel this is true across all grade levels, but more so in the elementary. I feel confident that our school district is navigating this new territory the best they can. Do you have all the answers? No, but no one does. I have trust in my district and the plans they have set forth. Thank you, Jody Rudnicki, kindergarten teacher, Northern Lights.
All right, hello Kelly. I'm wondering how the absences 10 per year is handled with COVID, as it takes up to 10 to 14 days at times to get results back. This will put them over the 10 days allowed. Can virtual classes have a face-to-face component? Example, if they are only going to be in school for 2 days and they have English first hour, the teacher is teaching that class 5 days a week regardless. Right. So the students are at home, would log in and attend class that way. It would help with budgeting, etc. too. This would allow for them to be in class with all their peers and offer support of the teacher to ensure everyone is hearing the same thing and able to ask questions, like a Teams meeting. Please pass on a big thank you to all the board members, teachers, and staff. Thank you, Angel Waters.
All right, thank you. All right, just a couple things as long as it's back to me. We did receive a number of statements that were anonymous. It's been always our policy to not read aloud the anonymous ones. The board does have them. The board has read them, but they're not read aloud. The other thing is I noticed, like in the one you just read, Laura, there was a question in there and asking Amy, we're not going to comment publicly tonight on any of these. However, they will be gone through and an FAQ sheet will be put together answering all the questions from all of these sheets. So
Great. Awesome.
that
It'll
will
be a big
going out.
FAQ.
It'll be a big FAQ.
Yeah.
All right, so the one I have, as a very active volunteer in the elementary schools, specifically Great Lakes, I have many concerns as to how the upcoming 2020-2021 school year will look for those choosing to send their kids to in-person learning. From my understanding, the classrooms have desks spaced 6 feet apart, or tables have plexiglass barriers installed to ensure social distancing standards. Extra materials, including cloth items, personal items, and excessive decor has also been removed. Art, library, and music will need to be taught by the teacher traveling classroom to classroom. Lunch will most likely be eaten at their desk. Bathroom breaks will be scheduled. Gym and recess will be held outdoors apart as weather allows. Will there be examples of what students will be walking into shown to parents, students, or families? The families really know what they're signing their children up for. How will you ensure that proper distancing standards are met? You won't allow more than 50 people into a school board meeting, masked and 6 feet apart, but you'll require 450 students and staff into the same building. How will arrival and dismissal work? Even with staggered start and end times, kids will be late arriving to school or will be trying to walk into or out of the school in groups with friends or siblings. You expect students to sit in their desks all day without center time, without small reading groups or working in project groups, and rely on teachers and staff to monitor and enforce these distance guidelines. How will social distancing work in the classroom? Will you have less than 10 students in a classroom? How will that work with buildings that are already filled to capacity? Will common areas be used as classroom supplements where other students will be walking past others? What are the side effects of constant use of sanitizer and chemicals? Do families know what the before-after school program will look like? Will students be put into their actual classroom for the before-after program or placed in other areas of the school? What happens when a student tests positive and has siblings in other classrooms? What will the protocol be when a student has to be quarantined for 2 weeks? Will they switch from in-person to distance learning and then switch back? What will you do when colder temps arrive and students need to wear cold weather gear and you cannot have windows open for airflow? Have you witnessed the amount of items students have in their lockers and overflowing from the lockers? Sincerely, Sarah Schubert McComb. Just so everybody also understands, we may not read the whole thing. We're basing it on the 400 words, which was what was required.
All right, I have one from Tate Hagelin Pagel. A quick internet search shows that in the last 20 years, there have been between 230 and 240 school shootings in the United States, not counting the ones at university and colleges. In that time, school districts have reacted by spending significant amount of time and money to train staff and students, reorganize the physical buildings, and change practices in the attempt to avoid a deadly situation in their halls. A few hundred children have died as a result of school shootings, and we have done our best to make disruptive changes in the hopes of preserving human life while continuing education. This week, and according to the Johns Hopkins Coronavirus Resource Center, 2,174 people have died in the United States as a result of COVID-19. In 2 days, more than 2,000 people lost their lives from a communicable disease we are still learning a lot about. We should be willing to make changes commensurate to the threat of human life that we have before. While there are issues regarding childcare and logistics that we still need to keep developing better answers to, we know the safest option for students this fall is to continue learning from home as they did for 3 months in the spring. The learning will not be as high in quality as it would if they were in school. Parents and the community at large will have their lives disrupted. As a father of 3 elementary-age children, I am living this reality. However, if we are willing to spend large sums and change our practices to avoid the small possibility of a school shooting, we should not reopen schools in light of a near certainty of death for a significant number of our community members. To use another historic perspective, 2,977 people died as a result of the attacks on September 11th, 2001. The resulting changes to lifestyle in the United States, the wars waged overseas, and the money spent to avoid a repeat of such a tragedy is something we have all lived through. At this weekend's rate, we are losing that many people nationally every 3 days. If a 9/11 scale attack was happening twice a week in the United States, we could not be going back to normal. Our schools should not go back to anything like normal when clearly there is a threat to people's lives.
All right, next one. Good morning. I'm writing to thank you, you and the school district for designing a very comprehensive and detailed orient document outlining the proposal of the 2021 school year. Although it seems nearly everything was covered, a few questions that I need clarified. Per the document, parent of a young student 4K are not allowed to enter the building or see their student classroom or teacher on the first of the school days. While I understand this is for a seasoned student, we all know that the first days of these young children are sometimes difficult, and I'm looking for the clarity what the first steps would look like for the students so young. How can a teacher and assistant successfully help emotional students who are scared, confused, and trying to figure out new things out that also having them maintain distance from their peers, etc.? It would seem like it would make more sense for a parent bringing the children in, mask and staging timeframes, as a parent cannot imagine dropping a 4-year-old at the door for the first time and never been in a school setting. 2, the document mentions water fountains. They only work our filling stations. This is great. I want to confirm students are allowed to carry these water bottles at their desk while in school. Some classrooms do not allow water bottles in the past. 3, 4K full days is new. Will there be rest time? How will this work? 4, will 4K be provided with technology access and digital learning from home? 5, what is a measure being used when these potential starting policies will be adjusted, either back to virtual learning or forward less restrictive policies? Is it pure amount of cases in our city, amount of cases in our school setting? What is the threshold for change? Is there a specified number or percentage of things will adjust? 6, if students start the school year on a hybrid model and circumstances change, are they able to move to a fully DL? 7, will siblings be on the same schedule, example, as will my middle school student be in person the same time that my Bryant 4K student? This is essential for some family childcare, but I also would prefer it just for the ease of scheduling. 8, how will truancy be handled when kids are quarantined? Will siblings of these exposed students be quarantined as well? Tammy Davis, parent of 3 students.
Dear school board members, my name is Megan Erickson and I am a teacher in the Superior School District. I am very excited to be teaching 4th grade at Northern Lights this fall. My coworkers and I ask that the board approve a plan which includes in-person schooling with social distancing next year. While in-distance learning this past spring, we found that many of our 4th and 5th grade students quickly became disengaged with their learning and missed social interaction. Social interaction, even at a distance, is vital to students' academic and social growth. Another reason we should have in-person schooling with social distancing is that many students come to school for more than just education. School is a safe place for many students. It is where they have meals provided and positive interaction with their teachers and other staff. We appreciate the time and effort the school board puts into protecting the safety of our children and staff. We look forward to hearing your decision. Thank you for your service and consideration, Megan Erickson, Aaron Vatney, Special Education Northern Lights, Jen Talarico, Special Education Northern Lights, Rachel Kyogan, 4th grade Northern Lights, and Ann Olson, 5th grade, Northern Lights.
This one's from Kara Downs. She asked, in terms of the high school students eating in the classrooms, will we have extended time for teaching? Would that increase our risk with all of the students since they'll have their masks off rather while they're eating? Thanks.
All right. This one's from Robin Reckinger. I usually don't have a lot of anxiety with regard to going back to school, but this year, anxiety is intense. I'm sure this comes as no surprise to any active school board and administration struggling to make very difficult decisions about reopening schools this fall. I'm not comfortable returning to school despite the measures being taken. I know it's best for kids to be in the school setting surrounded by caring adults, helping them become the best people possible. In my heart of hearts, I want to be in my classroom with those kids, but not in these conditions. I watch as local restaurants walk back their indoor dining plans, as even small nonprofit organizations continue to work from home as much as possible. And as retirement parties are postponed, it comes down to shared airspace and not truly understanding enough about COVID-19 and how it spreads. Thinking about sharing airspace with 10, 50, 400 plus people for nearly 8 hours a day is unsettling for me. I know the decision to go with a hybrid model for reopening schools this fall was not a decision arrived at lightly. It gave me some comfort to think that surely, given the research and recommendations from scientists and doctors about mask usage, that masks would be required in the fall. When I read in the board presentation, staff and students will be strongly encouraged, not mandated, to wear facial coverings when 6 feet of distance cannot be maintained, my heart sank. I love middle schoolers, but they are often unable to maintain appropriate social distancing, even on a good day. My anxiety about going back to school would be somewhat alleviated if I knew that masks would be mandatory when a distance of 6 feet cannot be maintained, during science labs, during small group discussions, during passing time, etc. We need to start the year with mandatory masks, and as the COVID-19 situation improves, we can ease up on mask requirements. If we start out with a lax policy, it's very difficult to enact more strict rules a few weeks or months down the road when they may become necessary. Sincerely, Robin Reckinger.
Okay, I have one from Lisa Radke. Good morning, and thank you for posting the district response plan. Below are some comments in regard to the scenario planning. Number one, why are face coverings optional versus mandatory in the hybrid approach? The CDC recommends use of face coverings to slow the spread. Wouldn't it make more sense to mandate them in order to keep the students in school rather than risk it and end up moving to all virtual again? In addition, if the city votes that face coverings need to be worn, why would schools be different? Number two, why are elementary students in class 4 days a week and high school is just 2? Number three, the plan notes that virtual learning will be different in the fall than it was in the spring. I hope that means high school students will get a full day of virtual learning with mandatory check-ins rather than 1 class per day with optional check-ins as was done in the spring. Number four, in the hybrid model, will high school students who are not physically present in class participate virtually with those who are on site? This would allow the entire class to engage as one unit. Number five, if a student is sick on their virtual days, do parents report absences with the attendance office? Number six, how will parent-teacher conferences be held? Number seven, will the district conduct a survey mid-fall to assess how things are going both from student perspective and parents? I think this would be valuable information. Thanks to the district for all that they are doing. I recognize this is not easy and there are many factors at play. Your time and thoughtfulness is appreciated. Again, this is a high school parent, Lisa Radke.
All right, this one's from Carly Caven. Dear school district leaders, tomorrow you will be voting on a plan to reopen schools in September. I'm reaching out to each and one of you to please choose an online learning model for all to start the school year. I can see not truly safe ways after viewing the district response plan for 2021 that our schools can keep cases down or stop the spread of COVID-19 until there are either a vaccine and or all students and staff wear masks. I strongly feel that through the 3 options of the detail, the only way we can truly start this new school year safely is by starting online. Looking specifically at the district response plan, as a teacher, I have many concerns for my students first and foremost. I teach sixth grade at this middle school. This is where students arrive the first day of school. They have mixed emotions and have tons of questions. Like, how do I use my lock? What is my lock combination? What is A day or B day? Where is FAA hallway? How do I carry all my belongings to my computer? How do I log in? Will I have classes with my friends in my elementary school? Will I remember my new teachers' names? These are just a few of the topics that will get the new Superior Middle School students solved. Our first 2 weeks of the school is not about teaching so much as setting expectations and modeling how we act in the middle school. This is done in many different ways, but usually we have a tour of the building and go on various stops throughout the building, which staff members explain how we go through the hallways, get to the gym, lunchrooms, guidelines, etc. Sixth graders are introduced to many of the new schedules, teachers, staff members, and even their own lockers by their homeroom teachers who also assign lockers. I have seen no mention in the detail explaining district plan mention of middle school or high school students exposed to do with their learning materials. Lockers cannot be used if it's truly follow guidelines mentioned in our plan. What are we going to do with their things? Bring a backpack from class to class? Will this affect the 6-foot rule of social distancing or add more clutter to the rooms? And this is from Carly Caven from a 6th grade teacher.
Hi, Kelly. I'm wondering if you could ask the board the following question regarding the virtual school option. It sounds like it will not yet be decided what type of school model we will use to start the school year, but parents will need to decide if the virtual model is right for their child by August 5th. If a parent would like their child to begin the year virtually due to the rise in COVID-19 cases right now, can they switch their child to the hybrid model partway through the year? Thank you, Katie Browen.
Hi, Kelly. There's one point I would like to hear discussed. According to the CDC, I'm considered to be at higher risk because I have asthma. I have heard that staff feeling they are at high risk should speak with human resources to look at virtual teaching. Sub-bullet point, how will the district determine who is considered high risk? Will there be a checklist? Will one person be deemed more of a higher risk than someone else? What will, another bullet point, what will happen if the district is faced with too many teachers falling into the high risk category? Will substitute teachers be asked to teach? Next sub-point. If a teacher becomes a virtual teacher, does this affect their position in their building and within their grade level? Will a teacher be able to return to the classroom at their school in their grade level, or will they be reassigned to a new building and or new grade level? Thank you. Penny Hudson, 5th grade teacher at Bryant Elementary, and also my son Landon's 5th grade teacher. She sent another sub to the same person. Should I keep going? She had an additional question.
Oh, is it under the 400?
It's on there.
Kelly's shaking her yes.
Okay, so I'll continue. Sorry.
Yeah. Okay, it's stable.
All right, so another question she says that she has. The district plan states students and staff groupings are as static as possible and having the same group of children stay with the same staff, end quote. I teach 5th grade and I have 27 students in my classroom for the 20 to 2021 school year. I have told my classroom will accommodate 18 of those 27 students. I am understanding that the remainder of my students will be in the overflow classroom. So her questions are, who will staff this? How will instruction be delivered to these students? How will these students be selected? Do I need to be teaching mobile or will my instruction be streamed in some way? If I do stream my lesson, how is it equitable for students? How will parents react when they find out their child is not working with the teacher in the same way as the other students in the classroom? Again, thank you, Penny Hudson, 5th grade teacher, Bryant Elementary School.
Okay. Dear board members, I'm ready to express my concern about this coming fall and starting school in person. I am concerned about the health of my students and my coworkers. I am concerned about meeting in large groups with which schools are. COVID-19 cases will increase in these large group settings. I I am concerned with the statistic that approximately 0.05% of children could die from the virus. Let's just say that we have 3,000 students in the Superior School District. That would be the potential for approximately 15 students who could die. That is 15 too many. My daughter is recovering from COVID-19, and I can honestly say that this is one of the scariest things I have had to go through as a parent. It is also extremely scary for the person who is infected. My daughter is a nurse. She is a healthy 23-year-old non-smoker who contracted the virus. She was not in the bars and she wears a mask when she is in public. She is fine, fortunately, but almost 4 weeks later, she is still has lingering side effects. COVID-19 is extremely contagious, even with precautions in place. Please consider the online approach for all students for the start of the school year 2021. When it is safer, we can go into a hybrid model, and finally full face-to-face when it is safe. Thank you for your time. Sincerely, Melissa Isabella.
Hey, this is from Richard Kaufman, and it says, in the current pandemic climate, I believe the most prudent course of action is to start the school year 100% virtually and not in person. Virtually beginning the school year is for multiple reasons. Number one, cases are on the rise in Douglas County and across the country. It is unsafe to expose students, parents, and staff to the risk. If it was too dangerous to meet in person back in March when the outbreak of COVID was starting, everyone is still vulnerable as the pandemic is at its highest rate of infection. Number two, there is research to support that children, especially high school aged, are more susceptible to transporting COVID-19. I do not think that this is prudent to evaluate the risk of community spread in light of this, and there is a source linked to that comment. Number three, from the CDC. Number three, starting classes virtually until the school district can get a better feel for the direction of the pandemic is a low impact course of action for everyone. It will also offer an opportunity to test out at-home learning at a controlled pace in case the situation of COVID worsens. Please protect the students, parents, and faculty from becoming a victim to this virus or perpetuating it within our community. I urge you to opt for the virtual learning instead of in-person learning to start the 2021 school year.
Good evening. I have a question in regards to shifting from in-person teaching to virtual teaching. If school has to close at any point, will teachers be expected to teach virtually from their classroom or home? If the answer is home, will the district provide teachers with quality internet service so we can fulfill the teaching expectation? My husband and I both teach in Superior, and both of our daughters attend schools in Superior. With my husband and I teaching from home this spring and both of the girls trying to complete their online learning as we try to present many challenges, not more than one of us could be on Google Meet at one time. Downloading videos and lessons took a long time, and trying to upload videos took hours. I called our internet company to inquire about faster service, and I was told it wasn't available in our area. Knowing that this was a temporary, to me, made the best of it, so not so ideal situation. Thank you for your time. Amanda Leopold, kindergarten first grade teacher at Great Lakes Elementary.
Dear board members, I'm writing in regards to the discussion about school plans for the fall. I want to first of all thank you, Amy Starzecki, the instructional coaches, administrators, and the many other people who have been and continue to work on plans since March. I also appreciate the communication over the summer and the surveys for input. All of the plans that I have heard about have pros and cons, and there isn't one plan that will please everyone. I support returning to the school buildings in the fall with the safety protocols I have heard about. I feel that distance learning full-time puts a significant hardship on families, especially those with elementary-aged children. Many of the families I work with are doing the best they can to make ends meet each month, and during the spring distance learning period, I heard from families how difficult it was to juggle doing schoolwork and working outside the home, especially if there were more than one student. I would like to at least start the school year in the building, to build relationships with new students and parents, and establish routines and expectations that could be carried over when we needed to transition to distance learning. The social and emotional well-being of our children is critically important. I don't feel that distance learning has the same level of connection as in person. Students learn best when they feel safe academically challenged, and joyful in their environment. Especially during the times we are living right now with all the uncertainties, it would be important to provide an environment for our students to feel there is some sort of normal where they are safe to grow and develop. I fully trust that the board, Superintendent Skarzaki, the coaches and administrators will continue to do what is best for our school with the current information they have. Thank you, Mrs. Sean Stewart, third grade teacher, Northern Lights Elementary.
This one's from Jody Wright. She says, my question is about about at-home support with the hybrid model. How will the secondary one cohort of students get teacher support during their at-home learning days if their teachers are teaching the other cohort of students? She then starts another sentence that's not completed, and so that's it.
This was, hi Kelly. If I choose to do virtual distance learning for my child, are we able to change our mind and do in-person later in the school year and vice versa? I'm the PTO president at Bryant. Has the school board talked about what the PTO/PTAs will look like for the 2020-21 school year? I'm a Girl Scout leader. Are we able to have extracurricular meetings at schools? Can we use a cafe or a room at the middle school to hold meetings? Thanks, Carrie Jo Kane.
Okay, I have on Dear School District Leaders. I truly appreciate the measures that the administrative team has explored for keeping our students and staff safe by reducing the number of students in the building at one time and placing them 6 feet apart. Superior School District is taking great measures to reduce the spread of COVID. While I appreciate that we are in an unprecedented situation with no easy solutions, we should be deeply concerned when our COVID planning states staff and students will be strongly encouraged, not mandated, to wear facial coverings. While no solution will leave everyone fully satisfied, we need to take the step to mandate face masks for all students and personnel working within our schools. How do we limit a COVID outbreak in a school setting? Research shows that the respiratory droplets are the major mode of transmission, and that 40 to 80% of people who spread COVID are asymptomatic, meaning even with a protocol taking temperatures upon entry, there is still risk. And then she has a link, face masks for the general public. Face masks reduce spread of COVID-19 by as much as 100%, limiting outbreaks. A recent published study on contact tracing of coronavirus in South Korea found that the children ages 10 to 19 spread COVID-19 just as much as adults do, while those under 10 spread it at about half the rate. Reopening schools will trigger outbreaks. Use of personal protective measures and social distancing reduces the likelihood of transmission. She has a link to the CDC article. For the safety of students, staff, and community, we need to mandate masks. Schools around the world that have successfully reopened have had a few things in common. Quote, when science looked at reopening strategies from South Africa to Finland to Israel, some encouraging patterns emerged. Combination of keeping student groups small and requiring masks and some social distancing helps keep schools and communities safe, end quote. And then there's a link to that article. We have a plan to keep student groups small and have students socially distanced, but we are missing a key component, requiring masks. If it is a matter of equity, as suggested in cloth face coverings in school, which is another link, let's address the issue of inequity instead of foregoing safety. I don't go anywhere in public without my mask. I cannot imagine starting school without that requirement in place. Masks need to be mandated for the safety of all. Thank you for your time and consideration. Amanda Lindquist, 8th grade English teacher, Superior Middle School.
Dear school district leaders, tomorrow you'll vote on a plan to reopen schools in September. I'm writing to implore you to choose to reopen online only. The safety is for our students and staff should be paramount in this unpredictable situation. Please do not excalibrate our students' fight against COVID-19. Please do not endanger our students, staff, and families of Superior. As I write this letter, our county COVID-19 case count stands at 74. Continued a drastic increase from just 6 weeks ago. Increased parallels with the Wisconsin count, which is showing largest increase since the virus arrived, according to Douglas County authorities. And the highest number of cases have resulted from community exposures, which is defined in public places, public gatherings, Our schools is the largest indoor public gathering space in the city, and our data shows these spaces are not common in which the spread of the virus. On March 13, Governor Evers made a decision to close schools. At that point, there have been 32 confirmed cases of COVID-19 statewide. That now you are considering reopening the schools. We have over 40,000 cases with nearly 1,000 new cases each day. It would be illogical, irresponsible, and dangerous to increase community exposure in such degrees as virus transmission is getting worse, not better. While I applaud the hard work of District Administrator Starzinski and her staff for putting the reopening plans, there's still too many theoretical and unrealistic expectations within our proposed plan. Young children and those special needs will be physically unable to adhere to strict guidelines regarding distancing of such objects. This plan as exists is unrealistic. Furthermore, we've seen large pushbacks from irresponsible members of our community to provide measures such as mask wearing and quarantine. It should be illogical to assume these community members, many of them who parents of students, will adhere to the district guidelines regarding to keep the children out of the school. Moreover, many families of our community cannot afford to take time off work and keep the sick student home. Any teachers in the district can give evidence of this undeniable fact. Outbreaks in our school is inevitable. There'll be costly terms on both health and finance. As I see it, our choices as follows. Begin school online only. And this is from Jesse Owens, second grade teacher.
Hi, Kelly. I'm wondering if there can be a clarification regarding if at any time we are hybrid, if teachers will be able to have the choice to attend meetings through Google Hangouts on Wednesdays. If no, can someone explain why that wouldn't be an option? I understand some people like meeting face-to-face and teachers could still have that option, but we showed that virtual meetings worked in the spring. If the worry is someone won't attend virtually, then those teachers need to be talked to. Thanks and good luck tonight. Kyle Smith, NBCT 2018 Superior High School.
Hello, would the staggered drop-off and pickup schedule be the same for families with multiple students in a school? Or would the staggered drop-offs go by grade? This is from Sarah James.
Okay. Question 1. What virtual plan are we going to use? Wisconsin virtual or something specific? Understandable, last year was an emergency, but most parents will not accept that this year there was no learning going on. My 6th grader finished in 30 minutes. Question 2. I have children that need IEP services. If I have them in virtual, are they still allowed in the school for those therapies? Also in the middle school, is the middle school going to have choir, orchestra, band on the days they are there? Question 3, if the counts and virus spread, will all children be sent home with laptops, even elementary, if we choose to keep them home after being in person at school? Thank you, Rachel Johnson, Four Corners at Superior Middle School parent.
I have one from Melissa Powell. Dear school board members, I would like to address the scenarios for opening school up this fall for the 2021 school year. I understand and appreciate the tough position you are in trying to figure out a way to open schools safely for students and staff. I am very happy to hear that elementary level students will have a somewhat quote unquote normal class schedule and be attending 4 days a week. I have a 5-year-old starting kindergarten at Northern Lights Elementary, and schedule and structure are very important and critical for a successful year for her. She has some sensory issues, and one thing that intensifies these issues is when there is a huge schedule change for her or a chaotic environment. I think some of these new changes that will be implemented this school year with fewer students per classroom will be very, very beneficial for her. My son, on the other hand, who will be a junior at the high school this year, will not fare as well with the current proposed 2 days a week of in-person instruction. I am very worried about his success should you approve his current schedule. For some students, virtual learning is the preferred method, and those students should have that option to continue their education that way. However, for my son, that way of learning, quote unquote learning, is not sufficient and he will struggle. Case in point, during the shutdown of school at the end of last year, my son made the B honor roll for the first time in his school career. He is a solid C student and I feel he did not earn the grades he was given. I feel that the grades my son was given are providing a disservice to him, and the district has failed him and will be failing him and many others if you don't find a better way to hold as many quote, in-person instruction and quote, days as possible this school year. I am begging you to reevaluate the secondary school schedule to accommodate these students who need to be in school full-time. Thank you for taking the time to listen to my opinion on these difficult decisions the district is facing. Sincerely, Melissa Powell.
Ladies and gentlemen of the board, thank you for taking time to listen tonight. I am certain that you've been plummeted with questions and comment over the last 2 weeks and months. I'm very appreciative of your time and consideration. My husband and I are both products of the school district. Our 2 daughters are working for their way through it now. I've just finished my 11th year teaching here, and my husband volunteers his time in the Superior Foundation. Like all families and teachers, I'm invested in countless hours and dollars to make the Superior Schools a great place to learn and grow, a place kids can feel safe. If we go back to school in a few weeks, kids won't feel safe. I won't feel safe. Many of our colleagues won't feel safe either. We will fake it, but one thing I know for sure, kids can smell a rat. Normally, many of us will spend weeks getting ready for school, labeling items, coming to new themes of the room, moving through around 90 degree classrooms unpaid, catching up with colleagues, building up nerves and excitement for the year ahead. We configure desks, we have our table spots based on our knowledge we have with our students. We might be good friends to a quiet girl or might help another student tackle some hard words, etc. We do this because our jobs are both art and science. This year will be different. This year we'll walk into a kindergarten classroom that instead of being warmed with welcoming place where parents can join while I read the kissing hand on the first day, nervous 5-year-olds will walk in alone. They'll meet a stranger in a mask. I hope they can tell me with my squinty eyes and my smile, but soon enough they'll be able to tell I'm just as nervous as they are. Students won't walk into the room with stuffed animals they can snuggle with during our read to self. There won't be any Legos or other blocks to play with. Through research tells us that block play is essential for cognitive development, especially math skills. There won't be any dramatic play. Center with kids dressed up and play pretend. Even though they know that how our youngest learners express themselves, learn empathy, there will be no play goes in my room, even though that's how students develop muscle and hand essentials for writing. And this is from Christy Matushak, kindergarten teachers, Great Lakes School.
Dear board members, I'm writing to express my concern about the upcoming 2020-2021 school year. My concern is for all involved, as well as those that we are either coming home to or taking care of. I worry constantly about the thought of heading back to the classroom with students and coworkers that are immune compromised, as well as those that are healthy. I worry about the health of the students and the risk of exposure to COVID-19 from all of those that they will be around. I worry for my family. My husband and I care full-time for an 87-year-old woman that has no family other than the 2 of us who have no biological relationship to her whatsoever. We have done everything we can to keep her out of the nursing home as they are still not allowing visitors. And the thought of her end days, years being alone are just too much for us to bear. I worry that I will no longer be able to care for her for fear of being exposed myself. I realize that teaching online in the spring was not ideal. I am sensitive to the families that need their children to be in school for very logistical reasons so they can go to work, provide essentials to their children. However, I also take into account the risk we are putting these families in by trying to go back, even with a partial schedule, when we are unsure of what the very near future holds with this pandemic. I know you understand the sensitive nature of all of this, but I ask that you please consider online school for this fall. There are still too many unknowns, and the safety and health of our students, families, and staff is far too important to take a chance with. I appreciate you and all you continue to do for the school district of Superior. Thank you for hearing our concerns. Brooke Pison, and Brooke is an English language arts teacher at our Superior Middle School. She then followed up shortly thereafter, and she's within the 400 words. Hi, Kelly, in regards to the cleaning comments, it was stated that the teachers would wipe down the classes after school. He said this would be about 30 to 40 minutes of time. Does that mean the students leave earlier to allow that time, or that teachers stay behind school hours to do this? This will affect those of us that have kids needing to be picked up from a different location. Also, I'm not certain if you are the person I should be sending this to, so if not, I apologize. I just wanted to make sure our voices and concerns are heard. Thank you, Brooke.
Sarah James, who I just previously read her question, had one more question saying, why don't the elementary school students go 2 days a week or every other week so that we could have similar class sizes, similar to what the CDC is recommending?
Hello. I'm wondering if a few questions I have can be answered during the school board meeting tomorrow, or at least in a reply to me. I have a 13-year-old who is going to be in 8th grade and a 6-year-old who is going to be in 1st grade. I'm still at this point very undecided about sending them to school next year, but I'm leaning toward doing all virtual. Questions. 1. Is there an option to start out the year sending my child to school and switching to an all virtual if we do not feel it is going well or start to feel the risk is too high? Conversely, is there an option to start virtually and switch to in-person to a degree as we feel the risk goes down? 2. My child is doing all virtual. Will he still be learning and communicating via who was supposed to be his classroom teacher this coming year? Herbstrom at Cooper. 3. My 1st grader has a speech impediment. He was meeting regularly in school last year with Mr. Adam Stevenson and was meeting virtually since March. Virtual speech therapy is quite challenging. If school is happening in person to any degree, but we choose to do virtual only, will there be a way for my son to have one-on-one speech lesson in person with Mr. Stevenson again, or is that only an option if we send him to in-person school? 4. The plan released states that screening, monitoring, and state assessments will still take place this school year. How will that look for virtual students? Thank you for all the hard work you all are doing to make this year work and keep the kids and staff safe. Susie Olson.
I have one from Minden Hallstrom, English teacher, Superior High School. To the members of the Superior School Board, as the district proceeds with plans to reopen the schools this fall, I must express strong concern with holding classes on campus. The health and safety of our students should be at the heart of our values as educators. We regularly state that it is, and it is time to place our actions behind our assertions. Yet with COVID cases more prevalent now in our community and on the rise nationally than they were when the state closed schools in the spring, somehow we are still discussing placing our families at risk through close contact. While a hybrid blended learning structure is primarily in consideration, please reflect on how collaboration will actually look in a COVID era high school classroom. My students will be situated at least 6 feet apart, preferably with clear safety shields and masks, though not guaranteed. My students will not be able to face one another. My students will not physically share any materials, including mentor texts, manipulatives, or annotating utensils, or move around the room for any activity. My students couldn't work collaboratively together without shouting across the classroom, which means that they will be utilizing online tools instead. Same applies to meaningful conferencing with me, as I will not be able to get close enough to see their laptop screen or sit face-to-face at their desk. I will also be utilizing online tools in order to engage with them in feedback, reflection, and goal setting. Essentially, everyone in the classroom will be working with online curriculum materials and tools while seated together physically in the same room. How is this a justified risk? Obviously, on-campus contact with students is invaluable for learning. I wholeheartedly prefer on-campus contact with my students, as I believe this is the most effective for me engaging with, facilitating, and assessing my students. but I'm not willing to risk our safety for my own preferred instruction. There are still a multitude of unknowns. Will a clear safety shield be installed on each desk? Will all students and staff be required to wear masks at all times? Who is providing the masks and ensuring that the masks are cleaned properly? Who will be tested for COVID and how often? Who will be paying for these tests? What is the protocol when someone tests positive? How is the district prepared to implement contact tracing? And what is the threshold of COVID cases? Again, that's from Minden Holstrom from the high school.
To whom it may concern, the Elementary Visual Arts Department, thank you for continued dedication and hard work in ensuring that our school district is reaching our best solution for safety and well-being for our students, staff, family, and community. With these thoughts in mind, we would like to address some of our questions, concerns, and possible solutions in regards and how teaching the visual arts could look at the elementary level for the 2021 school year. As you are aware, many teachers, staff, and community members, as well as departments, are curious to know what protocols are currently being implemented by our Superior School District to prevent the spread of COVID-19. Will there be a teacher handbook, policy, procedures, availability, and updated frequently to our reference with the district plans and to prevent spreading COVID-19? Is there a plan on how to clean properly between each class, and how will it affect the travel day and we need for other schools? How will we ensure that the student and staff do not arrive at school sick or exposed? As we know, hand washing is one of the best ways to help prevent the spread of COVID-19. How will this incorporate into our classrooms? These questions weigh heavily on our minds as the school year approaches. Upon looking at some ideas being presented, our department current situation, budgets, and materials would be unable to meet the requirements. We simply cannot support a 4-day week with our current class loads, or even 5 days a week if our class size is limited to 15 students per class. For specialties, more class means less time for each class, which means less time for each student interaction, curriculum, and contact. And additional travel to classrooms, art on the cart poses many risks on the time allotted to ensure safe sterilization and handling of our materials will grossly be compromised. On a typical day, we teach 8 to 10 half-hour classes back-to-back without any time in between. Take, for example, a 30-minute art instruction, take away 5 minutes for setup, and take down plus another 10 minutes of sterilizing materials, and travel another class means we have 10 minutes of actual instruction time. This current idea being presented becomes serious and problematic as the situation regards equity for our students and department, and a 4-day week would mean large majority of the student population would be unable to receive face-to-face art instructions. And this is from Tim Nelson, Carrie Gordon, Clark Anderson, Elementary Visual Arts Department.
Hello, Kelly. I'm listening to the board meeting. Here's my question. I hear a lot about all means all, etc. Parents have the choice for their child to attend in person or online. Where does staff choice come in? Does staff choice come in whether they want to be face-to-face or online? Thank you, Melissa Isabella, 6th grade English Language Arts, Superior Middle School.
This email is from Lauren Miller. She states in her email, they have mentioned a few times regarding what parents wanted from the survey results last month, but I think it would be important to develop another survey and send that out again. When I completed the survey, I didn't feel it actually reflected my opinions as a parent and as an employee. Can they send out another survey? It seems too early to make a decision. It just seems like such a waste of time and money to even attempt any bit of in-person schooling. It would be much more cost-effective, streamlined, and safer, in caps, to start all virtual. Lauren Miller, speech pathologist or speech and language pathologist.
Okay. I am writing this as a concerned parent and citizen of Superior. I am concerned about the health and safety of our children. I want the school board of the Superior School District to really think about the children they're impacting by their decisions by their decisions. The children you should really be thinking about, they're the kids that have had little to no contact with anyone since they were sent home on March 13th. The kids that were on the watch list for abuse. We need to get these children back into schools where they can have a safe place to go and a guaranteed meal every day. I think in our hearts, even if we are afraid of what COVID-19 may potentially do to us, we all know what the right thing to do is. We need to stand up for the kids that can't stand up for themselves. They need to go back to school to a safe environment. Yes, the possibility of contracting a virus may not be everyone's definition of safe, but not everyone lives in an abusive home. Please keep these at-risk kids in mind while you make your decisions. Lindsay Rowe.
All right, I have one. To whom it may concern, this fall will be unlike any other year any of us has taught. With so many unknowns, we have concerns as educational specialists. Unlike classroom teachers who will be consolidated to one classroom with one specific set of students, roughly 15, specialists such as the visual arts, music, physical education counselors, and teacher librarians instruct as many as 400 to 500 students within a single week. Teacher librarians have a unique role since we provide information literacy and collaborative lessons, as well as access to and maintenance of the collection, both print and digital. However, we have concerns that traveling to classrooms will increase our risk of exposure or transmission of COVID-19, as well as decrease the amount of time available for helping students and staff with regular library technology and collaborative concerns. Even so, we recognize that our unique skill set will be required to help students, staff, parents with the implementation of one-to-one devices at the elementary level. The American Association of School Librarians has recently published a document that provides guidelines for school libraries to continue access to materials, collaboration, and support. Please see the link below, and we have a copy of that chart with a couple of links, and it says, "Thank you for your time and consideration. Melanie Barsness, Deb Jones, Annette Albrecht, Molly Waring, and Alicia Orleski, elementary teacher librarians."
Dear School District of Superior Board members, we have made aware of the plans of opening school this fall, and we have concerns specific to teaching music at the elementary level, as well as proposals that address these concerns. Rationale. We do not feel it's reasonable to ask individuals to undertake the level of exposure being asked to elementary specialist teachers. At an elementary level, the music teachers typically have contact with 450 to 550 students per week across 25 or 30 classrooms and multiple schools. Wisconsin DPI recommends specialist teachers to travel between classrooms and teach outside. This recommendation is designed to help minimize risk of students. However, increases the risk of specialized teachers, but they acknowledge that the risk of exposure is difficult to eliminate. Exposure of to 500 plus students compared to 15 to 35 students need to be addressed. What procedures does the district implement to minimize this increased risk of exposure and spread? Have you considered a plan allowing specialists to continue some of their form remote instruction, thereby eliminating the risk? If students have one-on-one devices, this remote instruction could still occur during the regular scheduled school day and would not place additional burden on parents. A few points to consider. What happens if the specialist teacher conducts COVID? It could mean 500 plus students and staff, multiple buildings are exposed. When students at any one of the many classes are diagnosed, does this specialized need to be quarantined? How will teachers be notified in the case of exposure? Proposed solution for elementary music. The elementary music department is identified and wishing to offer district-wide virtual options that can be delivered for all students, whether they are experiencing learning in the school building or at home. We're confident over the coming weeks we can prepare materials that will most effectively address the elementary music standard given in the circumstances. We will work with administration to determine the specific details which will address students learning the music content while they're addressing the need to minimize contact between group with elementary schools. We know this has been a difficult situation for all the board and has needed to make difficult decisions. We appreciate your challenged work regarding safety, students, and staff. Thank you for taking the time to consider concerns and proposals. Sincerely, the music department, Darren Bursgiven, Amy Frame, Christian Hallstrom, and Lynn, I can't pronounce it, PTCKE. Thank you.
Because of the social distance requirements, many of us in the elementary schools will not be able to fit all of our students in our classrooms at the same time, and we will need to send out small groups of our students throughout the day to other parts of the building. So why isn't a cohort system being used in the elementary schools? Don Durfee, second grade teacher, Great Lakes Elementary.
Good evening. I have some questions regarding school resumption. Number one, how will you have kids socially distance on the playground? Number two, will you close down the entire school if there is a case within the building? For how long? Will all parents be notified if there is a case in a school? Number three, are cooking staff, thank you, required to wear masks while preparing and handling food? Number four, will kids who choose all virtual learning have the same teacher they would have if they were using the hybrid model? Number five, how will it be handled if there are children who are purposely spreading fluids? Example, licking hands and touching others, spitting on others, or sneezing on others? Kristen Turcott, that's a good question.
Okay, to the members of the school board. First off, thank you for your time. Everyone in this community has different dynamics and specific concerns regarding in-person school this fall. Ours is somewhat unique. My family has a 16-year-old student in Spear Senior High and a 9-year-old student who does full virtual school through eAchieve in Waukesha, Wisconsin, and has since kindergarten. We chose a different route for our younger child as he had a kidney transplant at 20 months old. We didn't want to put him at risk for getting sick as he is immune suppressed or having his kidney take a hit because of the virus. One of the best choices we have made so far in his 8 years post-transplant. Noon fully understands COVID-19 and the long-term effects it has on one's health. We want to protect our vulnerable son, but also have huge concerns about the welfare of our daughter. Our daughter is thriving at SHS. She is excelling and is a very good student who puts her studies as a priority and challenges herself. I wish to remain an SHS student and start her junior year this fall, but there are other options. We had hoped the virtual option would work for our daughter and our family, but are unsure based on the plans presented and may have to look elsewhere to provide an education to both fulfill her needs in high school and preparation for college. Like everyone knows, coming up with the perfect plan for every single one of our students in the student is impossible, but we feel the choices being offered this fall are very limiting. We can choose to send her under the hybrid model and take a chance the precautions work and no one around her becomes a positive case. Then decide what that looks like when she comes home and around her little brother. We would also be risking our son's health, who we have protected by choosing a virtual education prior to threats from a pandemic. We could choose the virtual option, but seeing that it will only include 4 classes is concerning and won't provide the basics of what high school learning is or challenge our daughter wants or needs. The document and plan drawn up are very thorough and detailed, but there are some questions we have, school board members and others, asking for approving any plans. And there are a number of questions, but that was the order, but so I still hope we look at the question.
We'll keep them and incorporate.
All right, that's from Dave and Sarah Beatty and daughter Brooklyn Beatty, junior at Superior High School in the fall.
I have one from Amy Adrahan. I hope that's how you pronounce it.
It is Adrahan.
Adrahan. All right, hello. Please add these considerations in weighing the approval of the COVID-19 district response plan. My daughter Ellen attends school at Great Lakes and she will be entering the 4th grade this year. First of all, thanks for all the work that you and the school board principals and teachers have undertaken to plan and adjust to this situation. You've had an impossible job to do and I truly appreciate all that you have done. But respectfully, the irony is not lost on me that this meeting is being held virtually because it's not safe enough to gather a limited amount of mask wearing, safety conscious adults for a short time, but you are deciding whether it's safe to send thousands of people into poorly ventilated buildings every day for 7 hours with no mask requirement. Based on the level of risk in my family, the existing state of rising cases in our state and nation, and the knowledge that in-person school will not be requiring masks, I know that the virtual option is the safest one for our family. But there has not been nearly enough information shared to base a well-informed decision on. I hope you can address these questions and concerns. Number one, I understand that the kids under the virtual learning option will be meeting virtually. How often, for how long, will this be split up by grade level? Number two, the virtual learning option will require that kids spend as much time on learning as those attending school. This seems fair, but precisely how much time is this? Expectations need to be understood upfront to make this decision. Number three, the teachers are all teaching their classes. Where are the teachers coming from to teach the students under the virtual learning option? Number four, will there be one-on-one meetings for students with the teachers, and how often? 5, last spring during online learning, there was hardly any instruction of new material. Will these meetings consist of actual instruction or just social communication? Number 6, my daughter has an IEP which has included her spending time each week with physical therapy, her SPED teacher, and a lot of one-on-one help with other assistants. Will this time be provided to her in all virtual options? Number 7, will there be more flexibility built into the virtual option with regard to completing work? Basically, it goes on, but modeling from last spring was unreasonable. And that is Amy, what did I say, Adrahan?
Board members, when is it deemed safe for the students and staff to return to school? I would like to propose another option for a hybrid learning scenario. I would like to propose the following changes to this hybrid plan. I would like to propose that primary grades follow the same plan as middle school and high school, forming a group A that attends Monday and Tuesday and form a group B that attends Thursday and Friday. All students would be on a virtual on attending days. Lessons could be streamed live for the students at home if possible. If there was a positive case in one group, the other group could still continue to attend classes, providing that deep cleansing would be done on Wednesday in all buildings. This would also help a large class size that our 4th and 5th grade teachers have. It would not require staff to supervise the other groups, which would minimize the cross-contamination of students. The groups could be coordinated so that siblings would be in the same group A or B. This would help minimize cross-contamination in families and community and help with childcare arrangements. We are all hopeful that life will return to normal sooner rather than later. We will want the best for our children and our most valuable population. A gradual and cautious approach to opening our schools will contain the virus, which in turn will save lives. And this is by Paula Delby, 3rd grade teacher, Bryant Elementary.
How will it be determined which teachers will be eligible to teach online? What factors will be considered for each individual staff member? What is the process and/or policy to determine which teachers will be teaching online? Emily Kelly, Superior High School English Language Arts Teacher, Assistant Forensics.
I have multiple emails here from Heather Morrissey. The first question in her email says, when are the new filters supposed to be delivered? Will they be installed before anyone enters the building? Next email, how many students and parents are included in the stakeholder groups? Number 2, if the City of Superior Council mandates a citywide mask ordinance, why would schools be exempt from that ordinance? Number 3, will SMS and SHS students be rotating classes? How will teachers disinfect between classes and supervise hallways at the same time? Next email, sorry, it's duplicated. Next email, will students be rotating classes at the middle school? What cleaning duties are expected of teachers in between classes? Each desk, sharpeners, plexiglass, if any, school supplies, example, color pencils, scissors, glue. Not all kids come to school with these supplies. Cleaning every single one between classes, question mark. Number 2, what about sharpening pencils? Multiple kids per class get up to sharpen, blow their nose, go to the bathroom, get a drink. SMS doesn't have water bottle filling fountains, I don't think, by the way. They will need to violate the 6 feet distance rule to do any of those, to walk to a sharpener, throw away garbage / paper, go to the bathroom, etc. Will masks be required every time a student gets up to move about the room? I don't want to deny students bathroom usage or pencil sharpening, etc. Worried that requiring individual Kleenex boxes, individual sharpeners, that is not realistic. I'm sorry, it sounds ridiculous, but these are basic everyday things that teachers deal with every class period, every hour. Thoughts, question mark? And she's a 6th grade social studies teacher from SMS. And then she had one more question, sorry, another email. If a teacher has been exposed to a student who is confirmed positive, wouldn't all, in cap lock, students that teacher has been exposed to, possibly all their classes, need to quarantine, question mark, especially if students rotate classes. And thus, if that student rotates in SMS or SHS, it could potentially quarantine a whole grade level wing.
Okay, this one starts off by, thanks for taking my questions. With the hybrid scenario regarding after-school activities at the high school and middle school, i.e. athletics clubs, is there a plan to get students not physically attending school on any given day to the building for practices, meetings that are held after school, such as an activity bus? Specifically, students who live outside the 2-mile walking radius but are still participating in clubs or sports. Additionally, is there a plan for meals on days that students are not physically in school, such as the curbside pickups that have been available this spring and summer? Brenda Goldfein, SHS parent.
All right, I have one from Melissa Ketela. Hi, board members. I know I emailed you all this weekend, but I have a few questions that haven't been addressed in the presentation and discussion. It has been stated that students in elementary will remain with their classmates for recess, lunch, and at other times of the day. Will there be opportunities for classes to be combined for recess, lunch, outdoor learning? For example, can we have both kindergarten classes be out on the playground together so they can see their other friends? Can all the 4th graders be outside working together on a project? Is there a limit on the number of students that can be using the playground at one time? Will there be any sharing of students across grade level for instructional and intervention needs? What about small groups working with SPED or the counselor? What will be the time that each building has allotted for AM staff meetings be used for? This might have been 7:45 to 8:45 or 8 to 9 last year. We will have additional duties such as cleaning, student supervision, or will we have additional duties such as cleaning and student supervision, or will we be allowed to prep and plan for the instructional day? According to the plan, all of our prep minutes will be moved to Wednesday afternoons. This is going to be extremely hard to prep for daily instruction at the elementary level where we teach 5 or more subjects a day. So we will have more materials to prep, clean, and move each day. Since teachers will be wearing masks or face shields, students may not be able to hear them effectively. Some of the buildings have classroom amplifiers and microphones that teachers use to make sure all students can hear them. Is the district looking at purchasing classroom or personal amplifiers for the buildings and classrooms that do not have any in place already? Thank you for your time. Melissa Ketela, parent and kindergarten teacher at Four Corners.
Good evening. I have a question / concern for the board about my hearing disability. I'm a hearing impaired and currently have hearing aids, but mostly I read lips at school. If elementary PE teachers are teaching outside, my hearing aids will be affected by weather, wind, and make excessive noise. On its own, the issue is something I can deal with. The bigger concern is if students are wearing masks, I will not be able to read lips either, creating a big communication issue. I am not sure of the solution to this, and I'm wondering if your thoughts are ways to address this. Just thinking for our outdoor PE and wanted to make sure our concerns are known. Thank you for your time, Samantha Wilson, Great Lakes Elementary.
Can someone elaborate to the board at the secondary level how block scheduling will be implemented? Thank you, Kyle Smith.
This one's from Sandy Peterson. Thank you for doing this. Earlier, there was discussion about notifying teachers and parents about positive COVID tests. What is the expectation when a teacher or classmate tests positive? Does the whole class quarantine or get tested? Will there be policies or written procedures on this? Question mark. Also, how does this look in the middle school and high school settings? Question mark.
Okay. My husband and I will be attending the school board meeting virtually on Monday as our daughter is an elementary student in the district. We read through the COVID-19 district response plan and wanted to submit some questions, comments beforehand for consideration. 1, it is stated that staff and students will be encouraged, not mandated, to wear facial coverings when 6 feet of distance cannot be maintained. If the city of Superior mandates facial coverings to be worn in all indoor spaces, will staff and students then be required at that time to wear them for the entire school day? We feel this is a must for everyone's safety. 2, it is stated that if students choose the virtual learning option, they would stay in the virtual learning setting for the entire 2020-21 school year. Are students able to start out the school year with the hybrid learning option and switch to the virtual learning option if parents feel uncomfortable with added safety concerns, confirmed COVID cases climbing, etc.? Or are we bound to what we choose as of August 5th for our child? And 3, if a student or staff member in our child's school were to test positive for COVID, would we as parents be alerted? Or only if you feel they had direct contact with our child specifically? Thank you so much for your time. We appreciate all the hard work the entire district has been doing to ensure that our kids are safe. We can't imagine what a huge undertaking this has all been. You are all appreciated. Kevin and Heidi Ramage.
All right, I have one from James Turcott, father of 4 elementary and middle school. I know we want things to go back to normal, and we all agree school is the ideal place for formal education with tons of benefits from the experience. We are not living in normal times, and we must resist the urge to act otherwise. Now more than ever, we must use good judgment and do what's best for the safety of our children. Like we teach them, it's safety first. Things will get better, but we must stay the course. Please share this quote from my favorite book/movie series, Lord of the Rings, as it has always helped with facing dark and/or uncertain times. Sam, it's all wrong. By rights, we shouldn't even be here, but we are. It's like the great stories, Mr. Frodo, the ones that really mattered. Full of darkness and danger they were, and sometimes you didn't want to know the end. Because how could the end be happy? How could the world go back to the way it was so much bad happened? When so much bad happened. But in the end, it's only a passing thing. This shadow, even darkness must pass. A new day will come. And when the sun shines, it will shine out the clearer. These were the stories that stayed with you, that meant something, even if you were too small to understand why. But I think, Mr. Frodo, I do understand. I know now. Folk in these stories had lots of chances of turning back, only they didn't, because they were holding on to something. Frodo. What are we holding on to, Sam? Sam, that there's some good in the world, Mr. Frodo, and it's worth fighting for.
Dear members of the board, will teachers be able to meet virtually for adult meetings? Last spring, Bryant Elementary was able to successfully meet daily with Google Hangout. I would hope that the teachers will be entrusted to again meet virtually for meetings on the 2020 Year 1 school. It makes sense to limit persons' meetings as much as possible to keep our teaching staff healthy. Thank you for all your hard work and dedication, Deb Mansell, 3rd grade teacher, and parents of 3 Superior students.
I want to start off by saying thank you to all of the leaders and stakeholders who have committed their time and energy to our schools and community. I recognize that being a leader often means hearing from people when there are problems. Please know that I value our board members and our district leaders. That being said, I have concerns. Upon hearing Mr. Albrecht's clarification at the start of the meeting, I feel the need to share my belief that the COVID-19 district response plan does not sufficiently address how and when the determination for September 1 will be made. In fact, the district administrator's letter in the opening pages of the plan explains that at this time, opening with the hybrid option is the plan. Therefore, it is not simply an indication of what the start to the school year might look like. It is an indication of what it will look like. I feel this is reinforced by the discussion thus far, being primarily focused on hybrid models and on-site learning. Rather than starting with the hybrid model and preparing for a shift to a fully virtual school day when things fall apart, we should move learning and instruction online with the intention from day one. This will help to level the playing field for all learners. All students, not some, will be learning in the same format, and all students and staff can remain as safe as possible. Virtual learning decreases the burden on our custodial staff and the likelihood that substitutes will be needed for COVID-related illness. If we can expect students to wear tops, bottoms, and footwear at school, we can expect students to wear masks. If mask wearing expectations are left up to individual families or teachers, there will be unnecessary power struggles. Masks decrease transmittal rate. As a staff member, I cannot even enter the building now when it is virtually empty without a mask on. No expectation of mask wearing tells me there is no expectation for the safety of students or staff. I wish I could blink, bring them all back to school safely, but that is not possible. I know what students and staff are losing by wanting to return to school virtually on September 1, and I believe virtual start is the only way to head back to school. There should be a plan which allows fluidity between virtual, hybrid, and fully on-site learning. Thank you, Rachel Holden Kaufman, Superior High School English Department.
Kelly, I'm listening to the board meeting and it seems to me that the decision has already been made to use the hybrid model. This is unnerving. I strongly believe that the course of action has already been selected from the plan the board is currently looking at approving. It should be focusing on starting with the all virtual learning. The all virtual learning is easier for the district to focus on because they can build off of successes from the end of the 2019-2020 school year. Focusing your efforts on discussing the logistics of an all virtual learning environment will give ample time for these unknowns to get sorted out. Instead of managing the what ifs of a hybrid model, please focus on setting up the district for success with a good virtual program first. Richard Kaufman.
Okay, this one's from Jamie Hunter. Student and staff groupings are as static as possible by having the same group of children stay with the same staff, in parentheses, all day for young children and as much as possible for older children. I have concerns with how this will look for special ed therapy services. I have a caseload of 40+ students in multiple buildings, most of which are usually in different classrooms. Some of our services are in the classroom. Some small groups and some individual pull-out sessions. How do we limit contact / potential exposure to the students and ourselves as staff?
All right, and I have one from Nancy Benner. Hello, as you consider the options for the upcoming school year, I want to let you know that I support, in bold, the district's proposed plan for fall 2020. I trust that administrators, many who are also parents in the district, use an actual science and guidelines from the CDC and public health to construct the proposed plan and will continue to as time goes on. Things to consider if you have concerns, not including those that are high risk or care for someone who is high risk. Have you bought anything online during this time? If you have, then you are okay with the folks who fill and deliver your order to go to work. What about every retail worker of every place you have shopped? While your contact time with them is short, they are in the building, store, or room for an extended period of time. What about the tens of thousands of children of essential workers who went to daycare during this time? She has a link to an NPR article, What Parents Can Learn from Child Care Centers That Stayed Open During Lockdowns. I know that there are many factors going into tonight's decision, and I leave you with a few quotes from Winston Churchill, a leader who made thousands of impossible decisions during difficult and divisive times. Quote, "Fear is a reaction, courage is a decision," end quote. And the last one is, quote, "The pessimist sees difficulty in every opportunity. The optimist sees opportunity in every difficulty," end quote. Thank you. Again, Nancy Benner, third grade teacher at Cooper Elementary.
One more.
I've got one as well.
Got a couple.
Okay, Steve.
Dear school board members and leaders, good evening. We emailed this letter to all board members last night, but was hoping it could be shared at tonight's meeting. We are writing this letter to let you know our urgent thoughts and feelings about reopening schools in the fall. As teachers and parents in this wonderful district, we believe the safety of the students, families, and staff and Superior has always been the #1 priority and should continue to be. With keeping this in mind, we strongly believe that given the current situation with COVID-19, the only safe choice is to reopen schools with virtual learning only. As you know, the number of COVID-19 cases in Douglas County is currently 74. This number has drastically increased over the last month or so. The increasing number of cases we are seeing in our area are similar to the other areas of Wisconsin. The increase in the number of COVID-19 cases has been directly linked to community exposure, according to Douglas County authorities. Having kids attend school in person will undoubtedly increase the number of cases because there's no way putting school populations together can be safely done at this time. The virus transmission is unfortunately getting worse, not better. When schools were closed this past March, there were less than half the number of COVID-19 cases than there are now. Why would we even consider opening schools back up in person when things are more out of control now than they were in March? We are learning more and more every day about this virus, and putting teachers, staff, students, and families on the front line is not how we do things in Superior. The decision to open schools in person is simply dangerous. As teachers, we know all too well that unfortunately, students are sent to school ill all of the time. Just this past January, there were times that almost half of our classes were out sick or sent home sick for a number of days up to a week at a time. Outbreaks in our schools are inevitable. These outbreaks could very possibly cost lives, precious lives of people we love and care about. We believe that we need to start the year with virtual learning because it is inevitable that we will most likely go that route anyway. Starting with virtual learning, however, will help ensure the safety of the students, families, and staff in our school district. And it goes on much further. Thank you for all of your hard work and dedication. Sincerely, Julie Milroy and Jennifer Hellenius, second grade teachers.
This email is from Brooke Pison. Crystal just said that virtual teachers and hybrid teachers will be maintaining the same expectations for all students. Does that mean that there are different teachers teaching the hybrid model than the teachers doing only virtual school? Question mark. If that is the case, how are they determining the teachers will teach, which teachers will teach virtually versus in school? Question mark. Again, Brooke Pison, English Language Arts from the Spruce Middle School.
All right. Hi, Kelly. I wish to address the board as follows. Dear board members, I understand the need to provide a solid education to our students, and I appreciate all of the hard work that has gone into preparing a plan for the fall. While there is no plan that will meet everyone's wishes and needs, my personal feeling is that the only safe way to return to school is through online learning. That would be my preference for the safety of all, including students and staff. However, given the plan that is being proposed, my biggest concern is that we are not mandating face coverings. There has been a lot of information about face coverings being the best way to prevent the spread of COVID-19. The current climate of COVID cases rising, I am concerned that not wearing masks increases the risk of exposure for all, students and staff, as well as people in my life who are immunocompromised and or at risk who could be exposed through me. Thank you, Jane Larson. And it says, please note if you are, I don't know if I'm supposed to read all that. Right there.
That's your email signature.
I got one more.
What's that?
That's just your email signature.
Okay.
Hi, board members and others. Thank you for your hard work, and I understand the impossible position you're in. However, I have some questions, and I have heard various rumors, and I have heard mentions of them during this meeting, which have prompted a couple of questions. In a hybrid format, I have heard that teachers will only have meetings and prep times on Wednesday. However, what happens when we need to contact parents? Many of these contacts are time sensitive and will not wait until Wednesday. When will we have time to help students whose current instruction is at home? Again, waiting until Wednesday to reply would not be beneficial to our student learners. Other things that come up may need some time, not even to mention additional time we need for cleaning. Again, thank you so much for your time and effort in putting into trying to do what is best for our students and staff. Christine Casino, 7th grade socials.
All right. Nobody else has any left but me? I've got the last one. All right. First off, I greatly appreciate the work and dedication the district has put into this reopening plan. When all means all, we all need to do our part to get our children back into school. If I need to help clean or escort students to their classroom, I would gladly do it. If I need to stay later to disinfect my work area so the students can come back and stay safe, I would gladly do it. Many hands make light work. Online learning is not the quality or amazing teachers do in the classroom. It cannot be compared. We need them to have a solid education, access to food, mental health needs, community resources, tutors, etc. My only concern for this plan is my 5-year-old. If my 5-year-old forgets or loses her mask, will you not bus her home? Can we have spare disposable masks for these instances? I am confident the district has the best of intentions for all involved, and I also feel safe sending my children back to school along with my returning to work at SHS. Sincerely, Claire Hubbard, mother of 4 Superior School District students, SHS Guidance Secretary. Anything? 0? All right. That takes care of public comment.
Before we move into the mask discussion, I just was wondering if we could reiterate what the purpose of the meeting is tonight?
Yes.
No decision has been made on which model is being used. Could we make that really, really clear?
It did come up a few times.
Yeah.
So we have created 3 scenarios, and we were directed by DPI to create a hybrid model that did not exist yet in our district, as the other 2 models did exist. So we've created all 3 models. When I asked Public Health if we were to start school next week, what model can we begin in? She said we would be, it would be appropriate to start in the hybrid model.
If it were to start now.
If I said next week, I said, if I were to start school next week, what would we be able to start in a hybrid model? And she said yes. So the communication that we've had that I shared in the last slide of the slideshow is based on local data and based on public health's direction to us. That would result in whether we would have to move into a virtual model.
So maybe some of just again, to clarify this, maybe some of the confusion is because we did spend a large portion on the hybrid model. But I believe
because that's the model
we needed that didn't exist. So I just wanted to make that crystal clear to anybody listening in the public that tonight is not to make a decision on which model we will use. It's to have all 3 models approved
and
available so that when it comes time to start school, when a decision has to be made based on science, based on what the CDC is saying and the public health is saying, we have a model that can be used based on that information at the time. Correct?
Correct.
Yes.
Okay.
And as an example, when we talk about the mask, the reason the mask language was drafted the way it was in the plan is because that is the direction that we got from the State Department as to how to direct it, as well as all other components in that plan. So none of that was Amy's opinion or.
Right. No.
And it was, none of that was set in stone at this point in time.
That's why we're here tonight.
Right.
So I put a plan together based on the literature we were given to use.
Given that the majority of these comments were staff members of ours, is it feasible to do another survey given the changes in new cases in our community to put out another staff survey?
Well, I will tell you that the results were very divided from both staff and from parents.
Right.
On opposite ends. So tonight you heard from people who oppose
Right.
not mandating, but you will also hear from people who oppose mandating. So regardless, you're never.
Not the math, sorry. I mean, about safety of returning to the
that.
district.
My question would be to you, how do you want to make decisions as to what model we land on? Do you want it to be based on a survey, or do you want it to be based on the direction of public health? Because you will never have survey results that will result in a clear picture.
Which brings me up to a point, Laura, you made that I thought, and I hope people hear it, because as you said it, I pulled it up here. If you go to the Douglas County Public Health, there is updates. The last update, I think, was the week that just ended. And actually cases are down. And this, according to the Douglas County Health, Douglas County Document Center COVID-19 numbers, there's 69 cases in Douglas County, of which 59 of them are here in Superior. Otherwise, they're in Lake Nebagamon, Solon Springs, and other areas.
That doesn't mean all at one time either.
Right.
Like there's not
Correct.
59 active ones.
Right. Right, yeah, exactly. Actually, I think they put it on here. So 55 of the 69 lab confirmed are already recovered. So that's a valid point too. So I'm glad you brought that up, because this is really good information as we move forward, because that's how decisions have to be made on safety of staff and kids. Because I don't think there's a single one of us sitting up here that isn't wanting what's absolutely best for our staff and our children.
This will be another morality issue though, is what I'm trying to say. Like, don't survey them then, but then we need to address, how can we make you feel safe? What can we do? You know, I think that is something we.
Well, I think we heard from staff a lot tonight about masks.
Masks.
And I think you guys need to think about whether that language needs to change in the plan.
Yep. So I know we're gonna have a conversation, but I can kick it off that I'd like to make an amendment to the hybrid model. I think it's page 13. Could we add page numbers to this document? And it's under bullet point number 1. And the recommendation or the proposal I'm trying to make would be to remove the word encourage and the word not, where it just says staff and students will be mandated to wear facial coverings.
Required.
Can we say they'll be required?
Required, yep, thank you. Required
I put
instead.
mandated from the, I took mandated from the
Encourage,
language.
not mandated, and change that.
Okay, yeah. And then in bullet point number 3, take out after where it says families to send your child with a cloth mask, take out the rest of that sentence. In the event 6 feet cannot be maintained.
So can students not have masks if they are sitting at their desk 6 feet away from students?
Is that what CDC says? They believe it is.
What was the
Well,
other
the
thing you
CDC says what I have there, so, or the Department of Health Services.
What was the third one?
Third bullet point.
You're on the wrong, I think she's in the actual plan itself, or is it the same? Okay.
I'm in.
Amy's doc, the COVID-19 district response plan.
Why would it be different?
Yeah, it might have just been.
So my only problem with having face coverings always is we do have some areas that they're gonna have to be removed at some point in time, like the teacher that talked about having hearing aids. So deaf and hard of hearing, speech. I hate to be so restrictive that we can't allow the teachers to say.
I'm trying to figure out what the rest of your second or your motion was. I'm trying to find, is it
To remove the 6 feet apart.
What part were you removing, Laura?
So it's on page 13, bullet point number 3, under
just
safety and.
Read what the sentence is.
It says, we will include facial coverings on the school supplies list this fall. We are asking families to send your child with a cloth mask, and then it says, in the event that 6 feet cannot be maintained, I'd want to take that out because I want everybody wearing
It's not even
masks.
on this one.
That is a summary of that document, because it's, I
This
could
is
put the whole
official
document on the
document,
slideshow, yeah.
So you've moved to make an amendment. I'll second your amendment.
So we have a motion and a second. Is there discussion?
My only question is, do you have direction for administration on how they handle students who are not in compliance? And
I'm waiting till Amy's done. I was interrupting her.
Oh, my biggest question is, how are we going to handle the situation when students aren't compliant and parents don't agree?
I would say the same way we're gonna handle the buses.
That they don't come to school?
They can
I
do
think
all.
that there's a litany of options that we didn't have input into how we would manage the buses. And I think that we can come up with creative ideas to encourage students to do positive, healthy things and mandate it the way we need to mandate it to make sure that everybody's as safe as possible. I think that's going to increase the possibility that they're wearing them. It's going to increase the possibility that teachers feel safer. And every mask that's worn and every minute that it's worn longer is going to decrease the amount of contact we may have with that. So I think we can do this. We've managed to get to all these other things. I think we can manage to work with our students and our families on the importance of masks for everybody to be safe.
I've inquired, Bayfield is also requiring face masks. I'm not sure what their enforcement will be, but that's what I heard from them tonight.
I guess my last question, just because these are the questions that are going to come to me, so I want to know where the board is at on this question. When students are sitting at their desks 6 feet apart, can they take their face coverings off, or do you want them all?
Under what she just motioned, no.
That's what I'm asking.
We need to make an exception for eating and drinking.
If you can maintain 6 feet distance.
Yeah, you can.
Then the mask.
Or you're outdoors, but.
Yeah, but I'm saying if you're in a classroom like we are, 6 feet apart.
Exactly.
Well, she took that
But the
language.
motion took that language out, so just to be clear on what we're voting on though.
I think we gotta tweak some of the language then, for that, but.
We are
Can we just say
asking
that-
somebody to try a cloth mask.
This is Tara, Director of Student Services. I want to just also mention, we have many students who receive services that physically cannot wear masks. So we need
Correct.
to come up with a plan with,
Yes, there have to be exceptions.
and how that would look.
Right,
Right.
we understand that.
And if they have an IEP that supports that, a 504 plan that supports that, or medical documentation that supports that, how would we navigate that with busing? Because I'm assuming many of those students require either specialized busing or generalized busing. And if they're not able to wear a mask, how are we circumnavigating that?
That I don't have the answer to. They wouldn't, I mean, they have the right to busing as part of their IEP services. They also will be in classrooms more than likely not being able to be socially distant. A lot of them need tube feeding, changing, and need 2 people to be doing that. So there are going to be staff members around students without masks at various times of the day.
So,
So can we come up with language that
That third
mask-
bullet point, it could either
You wanna
stay or
leave
go.
it?
It really doesn't matter if it gets stay or go. Because it says, in the event 6 feet cannot be maintained. So technically, if you're walking down the hall, getting off the bus, you're gonna have a face mask.
right.
If
And I
you-
still left the 6 feet above in bullet point number 1. Like I didn't ask to take
Right,
that
I'm
out,
just-
yeah.
Can we take the language from the Department of Wisconsin Health Services that talks about discrimination, trauma, and disabilities, and incorporate that in, that there may be exceptions for those?
Yes.
Because that's the language they used in that.
But I want to be really crystal clear because you asked a very valid question, Amy, because now from my understanding, we're saying all face masks, period, taking out that unless 6 feet can be maintained. Because your question, I think, is a very valid one. If you're an elementary school teacher and you have everybody sit 6 feet apart and you want to give a lesson where they need to see facial expressions or kids and
It's still in bullet point number 1.
then why would you pull it out of bullet point number 2?
That's why I said
It's just
really,
redundant.
Yeah,
mean, we
I hear
can
you,
leave
Sam.
it,
Just
but-
cleaning it up. We still ask families to help supply those masks though, right?
Yes.
Okay, yeah, because I
It
think
is
kids will do that.
Okay.
Yeah.
Sorry, I didn't know that's what you were saying.
Yeah, we're still.
That's what I wanted to be
in there. We
clear
just need
about.
to add to bullet point number 1, exactly what Amy was saying about the exceptions.
So where it says, where it has that
See
line that says
information?
see more information,
I
instead
would
of
want the
that,
link to what you said.
say that exceptions may apply specifically to blah, blah, blah that I just said on.
Somebody's gonna have to make an amendment.
Amendment to the amendment.
Oh, to add that? So
Let's wait till we get the language and then
Yeah,
you can say.
you can have it be discussion, but then formally it's gonna have to be made.
Can I withdraw my motion and amend it? Is that easier?
You could, yeah.
And then Steve, will you still second
Yes.
me? Okay,
Or
let's
if you just
do
make
that.
an
So
amendment.
now, did you make the motion to withdraw?
I'm gonna make a motion to withdraw my first amendment, to edit it, to include the language that Kelly is adding at this moment.
And I second that.
Thank you.
Is that legal?
Not
No, not right.
Close enough.
Yeah, I'd have to amend my second.
It can just be a friendly amendment as well, if Steve agrees to a friendly
Yeah.
amendment, right?
It could be either way, but she already withdrew
Okay.
it, so.
She withdrew it and redid it
Okay.
as,
Sorry, Kelly.
as one amendment.
So I just want to be clear on this. We are still going to allow people not to wear masks if they're maintaining the 6 feet. I just want to be crystal clear on
That's bullet point number 1, page 13.
Once you get out of your desk, mask should be on.
that. Okay.
Going through the hallways.
Yep.
Going through the
Yeah, make
hallway.
your own.
Which would be fine.
Which is exactly what restaurants are doing.
Right.
I mean, it's.
Right. No, I have no problem with that. I'm sorry, I misunderstood you, Laura. I thought you were saying, that's why I wanted to be crystal clear before we.
Well, and I want to be crystal clear about the fact enforcing this will be an incredible challenge for our principals,
Right.
Yes.
right?
But the safety risk to our staff and others.
I know, I hear you. I'm just making a point how challenging that will
But
be.
there's a lot of things that are challenging.
I know, but I'm just saying.
You're asking a lot. Do you want me to read Frodo again to you, Amy? The light will come.
It couldn't hurt.
And the government just
I don't
can't-
wholly under,
We got to remember.
What do you got? Hey,
Wait, Mike.
Mike, go ahead.
I don't wholly understand the overwhelming challenge for them to do that. And I hear what you're saying and I'm trying to understand it better. But I think about bullying policies and how incredibly difficult those are to maintain. I think about sexual harassment policies and how incredibly difficult those have been to maintain when they first came out. This is a challenge to us that we've never faced before. And there's going to be a lot of challenges. This is one of the one things that most people can agree on is that wearing masks as much as possible when we have kids in a room for that duration of time and adults, that is going to reduce the spread and harm of this disease. I think this challenge is something we need to take on. And I think it's something that we will figure out a way to make it happen. We've done it with other really challenging things. I think we can do it with this as well.
You know, I agree with you, Mike, 100%. And I feel like if we can get the message out that this is to help us get back to school as normal as we can, as soon as we can. I heard one kind of joke, but it wasn't a joke, that if they talk about taking the NFL away this fall, everybody be wearing masks immediately, you know, when you're having to take away things that really hurt. So,
Mike, I agree with you. I just want to validate the work ahead of us and know how hard they're going to work. So I agree 100%.
Yeah, thank you for that, Amy.
Yeah.
Can you see the language that Kelly added?
Can she make it bigger?
I can.
My eyes can't bend that far.
well, you gave me the smallest print one to read. That wasn't fun.
Or right, medical
process by working with.
medical operations.
So this was all the language from the DHS document, but likely needs to get pared down.
Actually, I don't think it does.
So is
I think
this-
those are important to have in there.
You just, yeah, after that.
After 5:04.
Okay, also,
Oh, Harry.
Yes.
Ryan just notified me, Teams meetings may be limited to 4 hours.
Oh, no. We're running on like
Thinks there
7
might be
minutes.
an exception for COVID to make it up to 16, but he's letting me know. So in the case we get cut off, I will set up a new live meeting. I will invite everyone who's a presenter right now, and I will post the new link on our website. So just wanted everybody to hear that in case this gets
disconnected.
In case we didn't get disconnected,
Or if we can wrap this up at like.
presenters will get a new.
Yes, 6 minutes.
Vote on this.
We'll get a new
Amendment.
Go for it.
And the new link will get posted on the district website as soon as possible. So, okay, continue.
All right, so we have a motion, and a motion and a second on an amendment to revise the language to require masks and to took away the 6 feet distance on the one bullet point. And what all did we add here?
And then adding exceptions, maybe sought through the IEP 504 or ADA process by working with the school health counselor and or HR as applicable. Exceptions may apply for anyone who has trouble breathing or is unconscious, incapacitated, or otherwise unable to remove the covering without assistance for medical considerations, including autism spectrum disorder and respiratory conditions, as well as traumatic personal experiences.
Okay, are we still in discussion phase, right?
I
We have the motion and a second on.
Wait, she's asking if this last part should be in there.
Any discussion on the last 2 sentences?
I feel like you've given the authority for the district to make exceptions. I don't know if you need that highlighted section.
Yeah, let's take it out. I would like to end it at the, as well as personal.
What do you mean we've given the district, like, because that would be my question. Is this going to encompass then the teacher who has?
Yep.
Okay.
So it says exceptions can be sought through this process by working with a health coordinator or HR.
Yeah, I thought that was for, staff and students, sorry, okay. I wanted to make sure we had staff.
That's why HR is up there too.
Okay,
Delete the purple.
Yes.
All right.
just wanted
There we
to
go.
double check.
All right. Anything else? Any other discussion
Does
on?
Tanya have to be on there as Director of Pupil Services?
No.
No, okay.
No, because
Just
the, well, I see what you're saying, but they'll work with Bryn,
All right.
part of the medical issue.
But does, before we vote on this, does Tara have anything to add? Tara, do you have anything to add to this? New language?
Director.
I heard something just about a specific disability where I heard autism. I just want to make sure we're not singling out disabilities.
You want to say including students with disabilities?
That could be. I'm kind of hit and miss trying to put a 3-year-old to bed, so I didn't hear exactly.
So for medical considerations, including disabilities.
Yeah.
And respiratory conditions.
Yeah.
Okay, that's better. Yeah, because I think it said autism.
Disabilities would be all more encompassing.
Yeah, because it could be EBD, it could be
Right.
things outside of ASD.
Any other discussion?
Yeah, why are we striking the 6 feet onto that section right there?
Because it's up at the top.
Mentioned at the top.
It's at the top already, so it's kind of redundant.
We're cleaning it up.
Okay,
Yeah, it says the same thing in most spots.
Yeah.
okay, gotcha.
That was what I missed.
There's other parts of the document you can clean up for me too, if you want, 'cause I'm sure.
All right, any other discussion? Hearing none, all those in favor of the amendment to the motion, say aye.
I,
You there, Rob, or you gone?
Lost Rob.
Lost Rob. Opposed? Motion carried.
He's in the bathroom.
He's there.
Well, he might.
He might be on a
Stepped
run.
away for a while.
Okay. Now, we still have the original motion and second to approve the 3 options.
The plan itself,
three
the overall
plan,
plan.
the overall plan.
Yeah.
Which are the 3 options.
So now we're to the discussion point because we already motioned it.
We made a motion and
the
second.
amendment, that's done. So now we can discuss the plan. Is there any other discussion on the plan brought forward tonight?
I do have a question when it's the right time.
It's the time.
Okay, I just don't want to interrupt anybody because I can't see everybody. I'm just wondering, someone had asked a question about a number. So did Douglas County Public Health give us a number where they said, you know, if we get into this range, this is where we might transition as a community into that virtual model?
No, the conversation we've had has been around, that other areas of the state are also in higher transmission rates. It's new to our county, but other counties have been in this rate and have higher rates. But those counties are moving forward with hybrid plans, so.
Okay.
She didn't give me a number that if we hit this number, we have to close schools.
So that's, hopefully if we can get her to come to our meeting in August, Mike, that's one of the questions I want to ask her.
Right.
You know, what are the triggers that take us from one plan to the next or back again?
And I want to reiterate, it is highly likely we may have to close school and go to a virtual model, not because of our numbers, but because of staff or student absences. Like that's a very high possibility.
Right.
Thank you.
Mm-hmm.
That was mentioned.
Yep.
Mm-hmm.
All right. Thanks, Mike. Is there any other discussion? Hearing none. All those in favor signify by saying aye.
Aye.
Opposed? Motion carries. I think we've already covered comments from members of the public. If there's nothing else, meeting is adjourned. Thank you, everyone, for your patience and time.
Is that official board meeting?
Nobody made it.
No,
Barely.
we had an
I
exclusive
think the
agreement.
record was the superintendent search. We were here till like 11 something.
We had an, we weren't even here for that.